Yes, that's correct. At this point, it's really an opportunity to go through some of the budget detail and for the board to ask questions and make comments. And we will be doing this for several Thursdays, and then we will seek to get input from you on those final 2 days. I think it's the 16th and 17th.
Okay. Well, I think if there are issues that commissioners would like additional information on or additional discussion in the future, those notes will be taken, and we will do that. So,
Okay.
Mr. Neufeld, go ahead.
Development process, we may want to talk a little bit about the revisit list.
Yeah, Gail has handed out a revisit list, and what it typically includes is really three aspects. One are RARs, and they'll show up as whether they're funded or not funded, and others CIP, same thing, and then there's room to add other topics. And so in the past, there are on occasion other topics that get added for further discussion. The revisit list is an opportunity for the board to let us know how to focus those last 2 days. It is simply a notice of interest in items that the board would like to discuss. And typically, when we compile that list, everything stays on it, so nothing's being eliminated. And then the board sees the results and makes a decision about which items to revisit to discuss further on those last 2 days. So it's a process that helps us to focus where the interest is in and possibly making adjustments to the budget. Typically, if something is funded and you want to discuss it further, that's with the option of partially or unfunding it, and vice versa. So if you're happy with something in there and you don't feel the need to discuss it further, then you can just leave that blank. So that's typically how we handle it. And that's the board's discretion. Typically, we set it at if 3 folks indicate they want to discuss it further, but it's at the board's discretion what that level is.
Let me add to that, if there's, in the past, when we've had the entire revisit list, then we've made a judgment whether there needs to be 3 commissioners interested in that item to revisit, or 2.
Right.
Usually if there's just 1, that item is not revisited.
I'm hoping someday that we'll set that limit at 7, but that hasn't happened yet. The other thing I would add is that Robin couldn't be with us today, so Gail Kaufman will be playing that role that Robin plays. And so you may call her Gail or you may call her Robin. And she will also keep me in line like Robin does. So that's also part of her job. And then Joe Connor's here because most of these are his departments in his area. Obviously, we have some governing boards later, but I'll turn it over to Gail, I think, for the next step.
I just want to make comment that you guys have all been handed out the revisit list, and that is just for the departments for today. You'll get a different revisit list with every week's presentations, and we would ask that if you could please mark those off as we go through or however you want, but return them to us at the end of the day. And if you could put your name on them, especially if you've got a comment in case we have any further questions, we would know who to go to.
And if you want to keep track of yourself, you can always make a copy before you turn it in, but it helps us to not wait till the end. It just kind of works a little better when we do it that way.
Okay, continue.
Okay, well, I'm going to take it from here. So good afternoon, Chairman and Commissioners. Joe Connor, Assistant County Manager, and today we're talking about Health and Human Service Departments as well as Culture and Recreation. The departments we'll be discussing today are Aging and Human Services, Department of Health and Environment, Developmental Supports, and Mental Health. And then we have agencies with our Johnson County Library System, as well as Park and Recreation District, which includes the museum. So with that, I'm going to turn it over to Gail to get us started with the presentation on Aging and Human Services.
So the budget analyst will go to the podium and start the presentation, except for when it's mine, and I'm just going to stay here. So, Ted.
Good afternoon, Chairman and Commissioners. Aging and Human Services budget. The charts will show you that the FTEs increased by 1. This is because of the added information and assistance specialist in April of this year. The budget will increase primarily due to the salary and benefit parameters, as well as increased bottom half expenses for ARPA funds primarily. And the tax support increase is going to primarily be due to the salary and benefits parameters. So I'm going to now turn it over to Tim to discuss the performance measures.
And I want to note, we were talking at ELT about getting accustomed to this, and I told Tim, you can just watch the departments before you, and he said, I'm first. And so Robin went in alphabetical order. So congratulations, Tim.
Yeah, thanks. I appreciate that. Thanks, Ted, and thanks, Chairman Eilert and Commissioners. My name is Tim Wolf, and I am with Aging and Human Services. And today I have with me Megan Leahy, who is our Director for Administration, and I have Jay Leak, who is our Deputy Director for the Area Agency on Aging. As you guys are all aware, I am the new, emphasize the word new, Director for the Department of Aging and Human Services. I've spent the past few weeks, 5 to be exact, learning various aspects of my job and getting ready for presentations such as the one today. As you guys are also aware, the Department of Aging and Human Services over the past year did see some key personnel changes which included the Department Director, Debbie Collins, as well as the Director for Area Agency on Aging, Dan Goodman. Megan Leahy then stepped in as the interim Department Director for 7 months until I started my job in April. Over the past couple of years, more emphasis has been placed on the aging population within Johnson County. The recent community survey that was completed placed Aging and Human Services at the top for the areas for improvement or where the county should consider adding additional resources. The aging population in Johnson County is expected to reach about 150,000 by the year 2025. That alone shows the significance of the Department of Aging and Human Services. When we take a look at our scorecard, you'll see that we have objectives and goals in 4 strategic areas. We have a number of KPIs that are associated with each of those, but I'm not going to go over each one of those in detail today due to time constraints, but I am available for questions if you have. Taking a look at our first objective, which is financial management, we have a goal to maximize resources to ensure maximum value. What I'd like to point out on our KPIs, and you're going to see it whenever we go to the next slide, is the value of our volunteers. In 2021, 804 volunteers provided 23,297 service hours for Aging and Human Services. That is equivalent to just a little more than 11 full-time employees. Our second area, which is community impact, focuses on providing comprehensive range of services and addressing the barriers to self-sufficiency. Much like our third area, which is operational effectiveness and efficiency, which focuses on collaborating for enhanced client outcomes and ensuring quick and convenient access to services, these areas have remained in the yellow zone over the past year. Like last year, the pandemic has had a pretty significant impact on us being able to fully reach all of our program goals. While we are seeing some increases in numbers, we have not reached where we were pre-pandemic. Our fourth strategic area is staff development and pillars of performance, with a focus on building strength-based, high-performance culture. I can tell you in the short time that I've been in my role, Aging and Human Services has a staff that are so dedicated and passionate about working with the populations that we do that I feel very, very fortunate to be a part of that team. I look forward over the next years, to really work one-on-one with each of those staff and really hone in what those strengths are so that we can continue to be such a high-performing culture there. I'm going to move on to our key points now and briefly discuss them. So through all the department has gone through during this past year, the consistent theme has been that we've continued to provide services to vulnerable populations within Johnson County. We launched a new online referral option as an additional way to connect with the information and assistance specialist. When call volumes are high, this online intake form can be another option to request information and assistance from the Area Agency on Aging. The staff working in these roles average over 1,000 customers a month that they deal with. Olathe Towers was opened as a new congregate meal site in 2021, making that 8 sites that we have throughout Johnson County at this point. We are hoping, currently, Olathe Towers is only open to the residents of Olathe Towers, but we're hoping to, in the near future, to be able to open that up to the public as well. Over the past couple of years, we were able to expand the rent assistance program to the cities of Shawnee, Mission, Prairie Village, and Roland Park. The assistance was already available in Overland Park, so that makes 5 cities that we're able to provide that program to. This month, we piloted a virtual microwave cooking class in conjunction with K-State Research and Extension. Seniors that signed up for the class were provided with the food and the accessories that were needed in order to complete the 3 recipes that were provided to them. It's a great way. We feel that we can start helping with that social isolation that many of our seniors are experiencing, and we're hoping to be able to offer some more of these virtual classes in the future. We recently received $1.6 million in ARPA funds to serve older adults. The majority of these funds are to be designated for nutrition type of services and social isolation type of services. And as we discussed earlier today, and you guys voted on it, we're about to, we're in the process of coordinating a third shelf life food and toiletry distribution. That'll be the third one we've done within the year. And at this point, we're about 800 individuals that are wanting this distribution. Over the past 2 years, the Board of County Commissioners has funded $500,000 to launch the Aging Care Services Program, which is modeled after the state's Senior Care Act. This was divided over 2 years of $250,000 each year. During the first year, we were able to create and fill an eligibility and options specialist position, as well as exceeded the projected number of adults that were served. During the second year, we've continued to increase the number of individuals served, and we're working hard to finalize 3 additional services, a handyman type of program, transportation, and companion services. Our team continues to see an increase in intakes, referrals, and assistance, and as you can see on the slide, there was an increase in 22% in 2021. Our service challenges tend to remain somewhat constant. Population growth among the populations we serve continues to expand, as well as request for services. Coupled with that continues to be the gaps in technology use that we've identified in these populations. We continue to look at these challenges every day, and we are trying to identify ways that we can possibly address those issues. Lastly, and I'm only assuming that you're going to hear this from other departments, is the challenge of recruiting qualified staff, as well as addressing the compensation pay issues that are within some of our positions. As I stated previously, I am very fortunate to have an awesome team of committed, passionate individuals. So it's very important when there is a vacancy that it is filled with a qualified individual who has a desire to work with these populations that we serve. And with that, I would be happy to stand for questions.
Ms. O'Hara?
Could you explain the Olathe Towers, they're not open to visitors? Is that what you meant?
So what I meant was we're not open to serving congregate meals to the public at this point. The meals are being served just to the residents within
Okay.
Olathe Towers.
And how many open positions do we have?
Within my department?
Mm-hmm.
I was going to say we have very few, 2 or 3.
Oh, okay.
Yeah.
All right. Thank you.
We're very fortunate right now in that aspect.
Okay. Yes. Some of our departments aren't so fortunate.
Yes.
Okay. Thank you.
Mr. Ashcraft?
Thank you, Mr. Chairman. Mr. Chairman, first, I wanted to acknowledge and thank the county manager because in years past, I've expressed an interest in seeing projected or, as presented here, estimated expectations of performance the coming year, and it's here. And we can discuss the importance or validity of any of them, but that's a significant step forward. I commend her and her staff and everyone for at least trying to think that way. That's a good sign and an important sign, so thank you. I'm sure it's because Mr. Wolf is here this year that it has all happened.
I would say the budget team, thank you, the budget team and those working on performance measures throughout the departments are the ones I think, but especially the budget office.
Well, and I haven't obviously been through everything, but what I've seen so far, it's been a consistent effort, so thank you. That's definitely a step in the right direction, so very good. A couple particular questions, Mr. Wolf. On your service areas, the first one, I think, is a good summary of what I think you're trying to accomplish, your mission statement about improving health, independence, and the ability to live in the community. I think that's a valid mission. I think it reflects the services that you provide. What I was wondering, though, is I'm struggling a little bit with the measures on two levels. First, I looked at the key performance indicators, and last year, under community impact, you had AAA diversion rates from nursing homes as a measure, but or a key performance indicator, but you don't this year. And then you also seem to drop in terms of staff development, overall employee engagement scores, and leadership development. So I'm just wondering what the thought process is and whether or not you think that the measures that are currently presented, which are good and I am supportive of, but are we actually measuring what matters, and what matters appears to be in your mission statement? Where do you think you are there?
Well, I can just say, being brand new, and I appreciate our conversation yesterday, I'm at that point of really evaluating all of our areas and the services that we provide. I do think it is very important that we continue with staff, with that leadership development, and with making sure that we are utilizing the PPD as much as possible to help those staff grow. When it comes to the statistic or the information regarding the nursing home and the diversion, I will have to ask either Jay or Megan if they can discuss that, as this was done prior to my arrival.
Well, and we can do that offline. I don't want to delay the presentation here, but they were noticeable gaps in terms of what was in there last year versus this year.
Ms. Ansley.
Thank you. I appreciate your comments, Commissioner Ashcraft, and I'd be interested in having a conversation also to talk more in detail about the performance measures, because I had a few questions myself.
Perfect.
Ms. O'Hara.
Oh, thank you, Mr. Chairman. So with people wanting to age in place, have you found that the increasing property taxes is creating stress within that population?
Commissioner O'Hara, I can just tell you what, in the short time I've been here, the conversations that I have heard. Some of those have been through the Commission on Aging, which you're aware of. Some of those discussions about the conversations that those commission members have had with constituents regarding their property taxes. I can honestly say in the 5 weeks I've been here, I have not received any calls regarding that at this point, but, and my staff haven't brought it to my attention.
Okay. I know that as I have been visiting with folks over the years, that is a stress point, because these people are on fixed incomes. And as their costs increase, which property tax increases are a cost, that it puts more pressure on them. and it, to the point that it could preclude them from aging in place. So we just need to be cognizant of that.
Having dealt with aging parents, there are several factors that come to play in making those kind of decisions, and certainly property taxes is one of them. Ms. Fast.
Yeah, I would say that, you have on here, launch an online service referral form. Well, putting the whole resource guide online was huge. No other area agency on aging does that in Kansas. So, that was just an incredible accomplishment. In terms of outcomes, Commissioner Ashcraft, some of these programs, the Senior Care Act is all about deferring nursing home, but, Meals on Wheels is hunger and wellness. So, different outcomes for different programs. I don't think you've listed all the, targeted outcomes on here. Senior Care Act, you can demonstrate how many nursing home days have being decreased, but you can't really say that for Meals on Wheels, but it's a factor, right?
Correct. And you're right, Commissioner Fast, in that not all of our key objectives are on there due to the vast majority that they have going on in the department right now.
You talked about the home repair. That has been a need forever. So tell me, how are you going to do that?
So we're in the process now of finalizing MOUs. There are two components to that. The first is a grab bar installation component. So for those individuals that need grab bars, there's the ability for those to be installed in their house. The second part of that is it's working in conjunction with Help at Home. It's a modified version. It's basically like a 3-month period of time that when they are moving to a new place and they need help in modifying or doing things around the house, then that service will be available for that.
Ms. Allenbrand.
Thank you, Mr. Chair. Well, welcome, Mr. Wolf, and what a great way to start your day, right?
Yes.
First of all, I think the survey also said a lot about how important and what services are being received countywide. And not only are some seniors have difficulties, and it could be taxes, but it's also, I can't get my roof fixed. Somebody take care of my yard. So there's a multitude of things which you guys help with as well. So, and then with COVID hitting, it was really hard to get out to some of the service centers and the independent living communities to meet with people. And so I know that there's a process in place now, being the liaison for the Commission on Aging. You do have a great staff, and we're working towards that. So I think that shows the amount of volunteers, which we need more. And then also, I think I shared this with Commissioner Fast, that the greater amount of aging is over in the Northeast, and then also Overland Park.
Yes.
So having enough centers for those meals is important.
Ms. Hanslick.
Thank you, Mr. Chair. Just a couple of comments, and would welcome your thoughts. First of all, to Commissioner Allenbrand's point, the Housing Subcommittee, that's one of the things we've been talking about, is how to increase access and availability of major and minor home repairs. We've primarily been speaking with housing staff in the planning department, because that's where housing is housed now, and but certainly there's many overlaps with Aging and Human Services. So we're looking forward to continuing those conversations and looking at how perhaps we can use some ARPA funding to help enhance that accessibility. And then to Commissioner O'Hara's point about the impact of property taxes on our people being able to age in place, that would be interesting to have the stats, because we certainly don't want to make decisions based on hearsay or assumptions. And I think it's first of all, people have to remember that, and I feel like I just say this all the time, but your total property tax bill, only about 20% of it is county. The most of it is schools, and we have no control over that. But also to that end, the state does have some programs. For example, the Kansas Housing Resources Commission has a Kansas Homeowner Assistant Fund that helps eligible Kansans pay their mortgages, property taxes, HOA fees, utilities, internet connections. It might be interesting to see if they have any stats on who from Johnson County has applied for those funds. And maybe the same thing with the homestead refund program through the Department of Revenue and the SafeServe program. Maybe we can get some statistics just to get some idea of how property taxes are impacting our seniors, and if that is a major concern for them in being able to stay in their home. Because again, we don't want to make decisions without real data.
Correct.
If you have anything to,
No,
that.
I'm glad you brought that up, Commissioner. It's one of those things that I have thought about of what resources do we have, and that is one of those resources that I recently became aware of and had been thinking about reaching out to them just to see what kind of stats and what kind of information they can provide me that might help us make those decisions.
thank you.
Ms. O'Hara.
Oh, thank you, Mr. Chairman. The percentage of the total property tax bill varies depending on where you live. Olathe, the percentage is less because they have their own library system. So it depends on where you live. And the numbers that I have seen in Overland Park, if you're in the Shawnee Mission School District and you're in Overland Park, that the county's portion of the property tax bill with parks and rec and library is approximately 24 to 25%. So it just depends on where you're living.
Correct. Okay. Thank you.
I would like somebody to clarify, that is not correct in my district, so I would like,
I said Overland Park.
Okay, well,
Yeah,
it's not
Overland-
correct in my
right.
district,
Oh,
and you
it-
keep saying, and I would like that
No,
information
no, I
corrected.
said
Can
Overland
staff, I'm talking, can staff give us that information by city?
We can resend it. I think that
Yeah.
we sent,
I thought you had sent that out earlier.
yeah, I'll find it and resend it, Commissioner Fest.
Yeah. Okay, all right. Mr. Connor, Mr. Neufeld, next step?
Next up is the Department of Health and Environment. And Gail will start us off, and then we'll turn it over to Dr. Ariola.
Yeah, I'll start you off. The total published budget will go from about 20.1, almost 2 million, to 21.05. Again, as what will be repeated with each and every department, a lot of that is our salary component to that. The local tax support increases from 13.23 million to 14.27. And then the budgeted FTEs, in '22, they were 151.34, in '23, 163.82. And although in the '23 proposed budget currently, there are only an addition of 3.5 FTE, the biggest difference there are items that have happened throughout the year and have each and every time come before the board. For a couple examples would be the transition of the medical director group over to public health, the immunization action plan that had some funding that had several FTEs, and those are just a couple examples of that. I'll turn it over to Dr. Ariola.
Thank you.
Doctor?
Good afternoon, Chairman, and good afternoon, Commissioners. Dr. Ariola with the Department of Health and Environment. With me today is Charlie Hunt, Deputy Director, Megan Sadler, Finance Operations Director. We've got Trent representing Environmental Health, Dr. Peterson, a Medical Examiner, Barbara Michelle, Community Health, and Dr. Ryan Peterson, the Medical Director for the EMS. And so the first slide is showing our performance, mission vision statement, as well as our performance metrics. We had several months ago really taking a fresh look at our metrics and redefined some of those things for clarity. And of course, our vision remains to protect the health and to be a trusted, innovative leader for community health, and protection of human health and prevention of diseases is our primary mission. So the four areas that we look at for objectives and strategy goals to ensure that we have sustained operations. And again, some of the metrics there is tracking our grants, tracking our fee recovery services, and then we've got community partnerships, and that's a key piece of what we do. Public health is really about building bridges into every part of the community. It is ensuring that we reach out to our community, especially those that are typically not at the table. And so what we are showing you is not all the metrics that we are tracking. We do have metrics where we are not just tracking the number of engagement, that we'll be tracking the quality of the relationship. And so those are there. Of course, we are tracking operational effectiveness, even though our primary goal is to protect health and to create an environment where every one of our residents can be as healthy as possible. To do that, we have to run very efficient operations, so we're tracking those metrics. And of course, we're tracking our workforce also. So quite a few of those are fairly new. For example, for community partnership, we are tracking the number of formal partnerships. We are looking at number of clients served, and we are looking at strategic messaging regarding news releases, inquiries, and social media engagement. In operational effectiveness, we are looking at performance achievement, which is a percent of the division of offices measures that meet targets, and we are also keeping our enhanced focus on continuous quality improvement. So those are what we have. I do want to mention that a key part of public health is a focus on health equity. Again, just ensuring that everyone, no matter what they look like, what their sexual orientation is, if they live, work, or play in Johnson County, that they have opportunity to be as healthy as the public possibly can be. Next slide. So the past couple of years been a lot of focus on COVID for us, been very busy, but it's also been so many other public health activities that we continue to do. I know that 2020, when it was time to consider reapplying for our reaccreditation, we weren't sure whether we wanted to do it at that time because we were just busy. We were pulling our staff from everywhere, but we decided to pursue that. Because what accreditation does is really ensure that as a health department that you are demonstrating the ability to perform what we call foundational public health services, as well as the 10 essential public health services. So by being accredited, definitely shows that we are meeting those standards, and not just those foundational health services, but some specific, region-specific needs, we are meeting those. So that's a very big achievement, even bigger because it was done during the pandemic response. The second bullet, we are showing what we have been showing. COVID vaccinations is what dominated our activities the past 1.5 years, but we also still continue to provide other vaccines to our residents. So in 2021, we administered 162,000 vaccinations. About 150,000 of those are COVID vaccines. We provided 12,000 COVID-19 tests, and we had over 150 community vaccine clinics. Those, we did purchase a van, and our community health largely was in the community, going to farmers market, going into businesses, and ensuring that we are making every effort to put the vaccine into as many arms as possible. And I think the broader metric to see is just the percentage of our residents that are vaccinated. Also wanted to mention that we had staff that were going into homes and vaccinating people in their homes. And really several hundreds of those were performed. We had worked with a transit agency, Josh Powers and his team, and we were able to transport people to vaccination clinics. We set up a clinic where we would bring people in that need self-transport with transportation, vaccinate them and take them back. Those were some of the things that we did in 2021, including a lot of efforts to vaccinate our older population at our skilled nursing facilities, long-term care facilities, independent living, and those things. And really, really proud of the work that we did in that area, that even currently we do see some infections. We're not seeing some of those serious illnesses because of the work that we did with them. High vaccination rate, but also working with them on the proper processes. We had retained early on the services of a geriatrician here, and when we had issues in those facilities, we'll go over there. She will look at their infection control process and offer advice to them. So the other areas that we focused on were to keep our schools open, and of course our childcare establishment. A lot of efforts went into those. And in all, we conducted almost 50,000 COVID-19 case investigations in 2021. And I think there's so many positives that came out of that effort. One of them is the COVID-19 dashboard. In collaboration with our AIMS department. And I think as on March 1st, 2021, it had 1.1 million views. I also want to mention the efforts with our health systems. We're still meeting with them, and we're beginning to talk broadly, even beyond COVID, on how to address some of the gaps with data access, but also the overall approach to moving health forward in Johnson County. Next slide. We have, thanks to your approval, a new HHW facility that's due for occupancy in the third quarter of 2023. It is more centrally located. We'll have an additional 2,000 square foot for better storage capacity and more efficient services to the public. And we expect to have some increased capacity starting from 2024. Our medical examiner's office conducted 2,347 investigations in 2020 and 2,772 in 2021. Now, of those completed in 2021, 389 individuals were brought into the facility for examination, and medical examiner, Dr. Peterson's been working really hard to make sure that we have a collaborative shared service with across the region. So there's an agreement that we had with Reno County in 2022. Also, Dr. Ryan Peterson is here. In 2021, I thought it's one of our major additions, major accomplishment. We welcomed the Office of the Medical Director for Emergency Medical Services into DHE. And Dr. Peterson and his team, extreme knowledge of the county, very, very strong in understanding what's going on, and just very insightful. And we're very happy that he's part of DHE now. And I do want to point out that in 2021, the Office of Medical Director received the American Heart Association's Mission Lifetime Award Gold Plus distinction for EMS. And I think more recently, you also have a publication that was really recognized nationally for some of what they do. Really, really
Dr.
impressive stuff.
Ariola,
Yes.
I just wanted to say that you said Dr. Peterson and you meant to say Dr. Jacobson.
Dr. Jacobson, thank you, yes. That's why he wasn't looking at me. So. No, Dr. Ryan Jacobson, thank you, Penny. Next slide. All right, some of the challenges that we have, what we want to do is to build a structure in the county that is able to, is going to allow us to meet our current goals, public health goals. One of the things that we want to emphasize is that the perception is that health equals health care, which is, healthcare is very important, but that's not all that we have to do in health. In fact, public health is all that happens before you need to seek clinical care. And that's where preventive activities, focusing on upstream activities, become very important. That's the overall concept of Public Health 3.0, which I'll talk about later. It is addressing those upstream factors that influences or determines health. And so we've been working on that, putting together what I call a blueprint, moving health forward for the county, working with all of our partners on how to ensure that we are better able to deal with our increasing population, increasing diversity, increasing in our older populations. And so that continues to be a challenge, is to ensure that we build the right infrastructure. Across the country, we have not invested very well in public health for the past 20 decades, and now we have that opportunity, and that's what we're trying to do, to reinvest in public health so we can keep an enhanced focus on health equity, so that we're able to address existing issues but be better prepared to deal with reimagine, or the next pandemic to come. We continue to work on the gap with data exchanges with our health systems. You noticed that was a major gap. We made some improvement, but still a lot of work to do in that area, so that those information are readily available for public health to make decisions about the county. And COVID-19, obviously, that was an unprecedented challenge to DHE. We do know that vaccination rate is, for us, is higher, is the highest in the region, higher than the national average, and very, very high, comparable to some of the highest in the country. But we continue to have to deal with misinformation, disinformation, and all the other factors. So we'll continue to work on ensuring that we educate our public appropriately. Next slide. So these are some of the proposed changes that we have. The fund.
If you want, I can go through.
Okay, all right.
Okay. There were several requests for additional resources, and we'll go, this first page is the ones that are currently in the proposed budget. There's a program manager for the population health and equity, and health equity. It's a dedicated position to move forward with the implementation of the Public Health 3.0 principles with the focus on health equity within the department and the community. There's one FTE for the business operations supervisor. It has additional, that is because of the additional financial functions brought over by the medical examiner's office, the medical director's division, and also they're looking for someone to help them to find additional funding from grants. They currently don't have that staff capability and to manage those grants. And I know one of their focus points is to bring in more revenue. There are 3 part-time medical legal death investigators which are each 0.5 each, so that equates to 1.5, and it's just the overwhelming caseload that they currently have to support that. And then they have a contract increases of $80,550, and about $11,000 is for the maintenance contracts for the medical examiner equipment, and then the rest of it is for the household hazardous waste hauler fees. They've got higher volumes, and therefore their transport costs are higher. Vaccines, we're $50,000, and this is not an unusual request. That is a cost neutral because those are for vaccines that they will charge out to the public for that. This next page are the ones that were requested that are currently unfunded, which it was a forensic toxicology technician for $72,000. nurse practitioner, physician assistant for $156,000. That was a medical director request. The mobile integrated healthcare telehealth platform for $42,000. That goes kind of in conjunction with the nurse practitioner, physician assistant. And that was just to create a new service level for the mobile integrated health to achieve the goals of the Institute for Healthcare Improvement. And with that, I believe we're open to questions.
Okay, questions? Ms. O'Hara?
Thank you. How many full-time positions did we add to address the COVID?
The positions that we added specifically to address COVID were all contract positions. And we have narrowed that down to 3 contract positions. Those are not part of the show.
Okay, so the number of employees within your department will actually shrink because of those contract employees that they have expired?
At one point, we had 40, 50 contracts, and that, I don't believe that that's shown as part of the FTEs.
Those contracted dollars.
Those are
aren't
contract
part of the
dollars.
top
That- yeah.
personnel savings, personnel salaries, they aren't part of the FTEs.
Okay, so where are those contract employees? Are they still at the health department, or?
We have 3 of them left doing case investigations. Yeah.
Okay, so is there an anticipation that those 3 positions will no longer be necessary?
They are contract positions. When they become unnecessary, we would let them go like we did the others.
So I was looking at the numbers, and in 2019, your full-time staffing was 137.31, and this year, it'll be 163.82, and I know that you brought in a new department. So how many positions are in the department that is now part of the?
So last year, there was, I believe, 1.5 FTEs for the medical examiner's office.
How many?
1.5, I believe, last year.
Okay,
And then the previous year in 2020, we added 5 FTEs to create the division of epidemiology. And other than that, the additions there would be EMS director coming in.
and what is the purpose of establishing the Department of Epidemiology? I mean, isn't that a function that could be, if in times of need like a pandemic, wouldn't that be more of a contract position rather than a full-time development of a department?
No, epidemiology, thank you for the great question. Epidemiology is one of the central science and capabilities of public health. So we deal with epidemiology every day. It is how we look at the trends, it's how we look at the numbers, to use numbers to make decisions. It's how we track infectious diseases. It's how we track chronic diseases and injury. It's how we, it's a support thing that we pull data together in our community to get a picture of what's going on and to be able to track out whether we're moving the needle on metrics of health. That's a foundational capability of public health. With or without COVID, actually, when I got here, when I came for here, even before COVID, that was one gap that was glaring in the department. So that's going to continue to be needed with or without COVID.
Okay, thank you.
Other questions?
Thank
Mr. Ashcraft?
Thank you, Mr. Chairman. Mr. Arreola, you've had an interesting tenure in Johnson County. I hope you're not missing Nashville, but you've stood up well, and I commend you for that. A few questions, though, related to the budget. The first one, it may be incidental, and maybe it should be directed to the county manager, but on slide 13, it talks about the mobile integrated healthcare telehealth platform. That looks like just a one-time expenditure. Why was that not considered in this budget request? Am I missing something?
Do you want me to start? Okay. So the mobile integrated health care telehealth platform, and Dr. Jacobson, you might want to get up, is tied to the preceding bullet of the nurse practitioner physician assistant. So those are together.
That's
Yes,
a sufficient response, thank you. Dr. Ryan, you don't need to. So, in particular, though, I was wondering, there are several funded positions on slide 12, business operations supervisor, and we can discuss this offline, but I'm just curious because in 2020, we added 2 FTEs in administrative staff, and I'm just wondering what the overlap or opportunities are there. And then on the next one, the medical legal death investigators, we had similar type of positions, one in 2019, 1.25 in 2020, one in 2021, and one in 2022. So we're adding another 1.5, and I'm just wondering these investigators what the metric is in terms of the return on investment and how that all works, because some of those were part-time positions, and I just don't see how that works based on the paperwork that's presented.
Right. So Dr. Peterson is here if you want to come. I think it's related to workload, but come on.
Yeah, and I'll start, Commissioner. I think this is something that Dr. Peterson and I have talked about here recently. And as they continue to evolve with overall increase in workload, they have recruitment and retainment issues of staff. And so I think she's concerned about, having some additional folks to help cover on call. I'll let you get into a little bit more. But this, to me, was an issue of trying to retain the folks that they have and try to come up with a different business model based on volume. So.
Which is correct. So those positions that had been added previously, when I first came on, I think I was given 2 full-time positions, which is not enough to cover a 24/7 operation. And so then initially we added 6 part-time positions on call, and that was impossible to retain individuals on a permanent on-call, less than 20 hours a week case. People just don't want to work that. And so we consolidated those 6 positions into some full-time. And then last year, I added an investigator administrator. So currently, I am at 4 full-time investigators, a chief investigator, and an investigator administrator. The administrator does not go on scenes. He simply does the administrative part of investigations, answers the phones, takes reports of death over the phones, gathers medical records, etc. The other investigators do conduct scene investigations. And as was listed in the accomplishments, last year we did almost 2,800 scene death investigations, and our scene investigations went up 25% last year. And so basically at this time, most days for the 24-hour period, I only have 1 investigator on at a given time, which is not enough for the county this size. And so the metric that we are following is investigator response time to scenes. Our goal is to get to scenes within 45 minutes. If I only have 1 investigator on and more than 1 scene happens at a time, then each subsequent scene gets delayed. That case in point, just this Saturday, I know you saw in the news, there was a homicide in Olathe. At the time that my investigator was on that scene, he got 2 more scene phone calls, and those had to be delayed until he was done, and then it compounds from there.
So there are some RARs previously that are being withdrawn or reused elsewhere? Am I understanding that correctly?
My understanding is that we combined on-call, which have a certain amount of funded hours, into a full-time. That's what
Correct.
Dr. Peterson said.
That just was not clear in the material that I reviewed, so I misunderstood, I apologize. So, Dr. Areola, a global question. Dr. Peterson answered for the coroner or the medical examiner's operations, but over the last 5 years, we've added about 15 positions, which includes a new function. So have we made an impact on the services that we should be making an impact on in terms of your mission expectations? I have been trying to interpret that from the performance metrics in the dashboard, and I'm just not seeing it. So any elaboration would be appreciated.
Thank you, Commissioner. Excellent question. I really, to start, I think the big FTEs there were the 5 with the epidemiologist, and I don't even want to imagine where we would be if we didn't have those positions responding during the pandemic. So they made an immediate impact. We had an epidemiologist assigned to each of the schools, to our child care centers. And right now, the actual metric that that's important is for us to begin to see improvement in metrics of health in the population. And we have a lot of work to do. Our epidemiologists are very essential to that. What we typically have done in public health, and I'm not just talking about the county, is really focus on specific health outcomes. We look at cancer, we look at obesity. And so the idea behind Public Health 3.0, which the resources that we have built in epidemiology is looking at upstream factors, how we design our cities, how we build our schools, how we build our roads, all of those other factors that impact health. We're going to begin to work with our partners, UCS, Catholic Charities, and hopefully we will get to where we will need to be in the next 10 years. We are constantly ranked #1 in county health rankings, but as I've said before, we're doing very well. The reasons for the rankings are related likely to our high socioeconomic status, and our parks library, which we have invested in very well, are contributing to that. But there are some metrics there that really shows us that to maintain that and to improve on that. Again, #1 in a state that's number 20 out of 50 states, in a country that's 20 out of 32. While good, there's a lot of work to do. So we will begin to share those metrics of population health, which don't move quite as quickly. Again, population is increasing, diversity is increasing, but those are very important for us to be able to meet our foundational capabilities.
One follow-on, Mr. Chairman. And Dr. Arroyo, I appreciate the comments. Last year, you had smoking as a key performance indicator, but you seem to have dropped it this year. And it goes to your point, because I think conceptually you're right, but that one was taken out. But the one that you mentioned that I've raised this issue in the past, we are #1 in terms of our overall health standing, if that's the right terminology, in Kansas. But what we don't seem to track is whether or not we are actually improving relative to ourselves, or if the rest of the county and the rest of the nation is sliding, and we're just not sliding as fast, which is good, I suppose, but it really doesn't get to the core mission of public health. So will you be including that in the future?
So yes, really, you pointed out a lot of really good points there. So we track a lot more metrics than we're showing you here. So smoking that you mentioned, obesity, there's several health outcomes that we are tracking. So yes, we'll be looking at all of those factors. But to, again, reiterate what you said, is that health is very broad and is impacted by so many factors. Some of those factors, public health do not control. So working with our partners, housing, public works, facilities, UCS, health partnership. All of those are very important. That's why we are measuring. So we went up, rather than looking at smoking, and we went up a little bit to the 20, 30,000 foot level, which is where we need to be to look at metrics of population health. But you rightly said that again. We just spend a lot of time and resources more on healthcare, where in the United States it was about $12,000 per capita a few years ago. It's almost $16,000 per capita. About 20% of our GDP is spent on healthcare, which is about $4 trillion. But we are number one in healthcare spending. But if you look at the 32 OECD countries, we rank 28 out of 32. The difference between us and those countries is they spend more resources on those upstream factors that impact health, ensuring that the environment is one that supports health, ensuring that our social services, aging human services, all of those things are things that we make investment in, that eventually in the future we'll see improvement in metrics of health. That's why we moved up from specific metrics, and we'll focus on those one working with our partners.
Thank you.
Thank you. This question is for Dr. Peterson. Did I understand you correctly that last year you did 2,800 investigations?
Correct.
Is that correct?
That's correct.
And what kind of schedule are you on this year, comparable?
This year, I think we are roughly similar, if not slightly above.
Okay. Well, I don't know how many people imagined that your office did that number of investigations, but I think it's good information for the public to understand the high level of activity that occur in your office. Thank you.
You're welcome. Thank you.
Other questions, Ms. Fast?
Yeah, on Dr. Ariola, on here the two not funded is, well, three, the nurse practitioner, the mobile integrated healthcare. Can you talk more about that? I mean, was that mobile integrated? Would Dr. Jacobson be working with like my Northeast Fire District on that and the MedAct? Can you say how those two, I mean, you brought that forth because they're a need, so please, talk about that.
Yeah, sure. So there's a huge number of people whose needs aren't being met when they call 911. So just in our community, year over year, we run about 2,700 to 3,000 individuals that are overwhelmingly elderly who call 911 for something called lift assists, which means they can't get up off the floor. They're so debilitated or ill that they can't get themselves up off the floor. So we traditionally send a fire truck and we get them back up to their feet, do a brief assessment, ask them if they want to go to the hospital, and they frequently don't go to the hospital. There's some literature out there in the evidence-based publications that show that within 2 weeks, that lift assist population, 21% of them will go to an ER and be admitted to an ER. 14% of them will be admitted to the hospital within 2 weeks, and 1% of them will die. So it's a very kind of a canary in the mine type of problem. So we have this persistent group of folks in the county that when they call 911, their needs aren't being met. So we envision this type of position to have a mid-level that has an elevated scope of practice above a paramedic and an EMT that can prescribe medications, that can work with the outreach nurses from DHE, that can work with our co-responders from mental health to provide medical screening exams, can work with involuntary committals on the medical aspect side, as well as provide the EMS providers that additional medical support that exceeds their traditional scope of practice. Unfortunately, the 911 system in the country is under the DOT, the Department of Transportation, and we treat patients still as cargo. So if we don't transport them in an ambulance, we get zero reimbursement. So currently, we can work a cardiac arrest on scene for an hour. We can use all of our medications. We can have 15 people on scene, and we get reimbursed to zero for that. So having the ability to go into people's homes and provide that in-home service to folks that were not meeting their needs on the traditional 911 side, we would be allowed to recoup some of that revenue by billing Medicare through telehealth, and that telehealth platform was kind of bundled with this as getting a longitudinal medical record up so we could track those kind of really high-risk patients in the community. I hope that answers your question.
No, this is a great issue. This commission knows I've been advocating for this because as a frontline hospice social worker, I saw, people calling fire 6, 7 times a day, and then once when they would go on hospice, and they wouldn't be calling at all. And that's why I've talked to my Northeast Fire, who I think is now calling our home outreach nurses to assist, because they have so many people that call over and over in a week, and it's supposed to be integrating with the co-responders. Is that happening? Because my understanding, my Northeast was calling, assistance from, a person at the health department. So can you explain, is that happening or not?
Yeah, so great question. We created something called the Community Outreach Referral Program, or CORP as we call it, from our office about 5 years ago. And we've outreached over 1,000 people in that time period, and they are generated primarily from fire and EMS providers in the community who run a 911 call, and when they leave that call scene, they say, we're not meeting their needs. This didn't fix the problem. So to help them get the resources, they refer it to our office, and we ship it out to either the Department of Health and Environment's outreach nurses for outreaching, or the mental health co-responders to follow up. And between that group, they get some services, and they can get a visit to their home and try to get some kind of wraparound services that the 911 providers have identified. The biggest challenge with that group is that none of those folks can prescribe medicines. None of those folks can do like a telehealth visit or actually coordinate with with a physician, get them help with follow-up, and do the medical care that a physician or a mid-level would historically do. So that's the big missing piece in this kind of mobile integrated healthcare concept, is we don't have the provider with an elevated scope of practice to go in and be able to look at their medications and maybe change the medication, or get them follow up with their doctor, or communicate with their primary care physician to avoid that subsequent ER visit, hospitalization, or death.
When I look at the costs that we're right now paying for our ambulance to go out many times, or fire to go out, our 911 dispatches, you bundle all those costs right now. A police goes out. Sometimes you'll have police, fire, ambulance on these assists. It more than pays for the request that's not funded. I think this is incredibly needed, and I will be continuing to advocate this is put in the budget.
Other questions? Mr. Myers?
And my understanding is on this request, one goes with the other.
Right now, the EMS provider's medical record that they document in is an incident-based medical record, so it's based on a call number. If we run, you call 911 and we run you, your information's populated in the medical record. If we run you 3 months from now, we don't track. It's not like the hospital record where your doctor can see all of the visits and we can collate you as a patient. We look at the county as an incident, and that's standard across the industry, unfortunately. This would allow us to move into the platform of having a longitudinal tracking system that would actually treat the people who call 911 and get this service as a patient and not just as an incident, so we could track the individual over time through a common medical record. So that was some of the upstart cost of getting a telehealth platform that could actually document longitudinally, have a telehealth capability, and it's HIPAA compliant and all that. So that, and then there'd be some ongoing subscription services, but we anticipated some upfront starting costs for that. That's what that is.
I just know from my own experience that I'm surprised that this assist number isn't much greater than what it is, and I think it's going to continue and become much greater. But I myself have been an assist person many times in the last 2 or 3 years, and again, I would think this service and this activity would take place at a greater frequency, and is going to take place at a greater frequency with population aging at the rate that it is.
Okay. Other questions? Ms. O'Hara.
Has there been a cost analysis on this?
There's really no national standard on how these are implemented. They're very local based, because you can imagine Kansas City, Missouri is very different than Johnson County just in demographic and resources. So they tend to target the thing. Like, we don't have a problem with pediatric asthma like they do in Kansas City, Missouri. So they're very targeted to the population. So sometimes those are, they have payers, like a pediatric population is typically got a commercial payer or Medicaid. But depending on the older population that we would be targeting would be generally Medicare as a payer. They generally reimburse about $150 for a visit from like a mid-level or a physician, like a telehealth visit. So if you do, if we outreached roughly of the 3,000 a year that we have, if we got 1,000 of those on kind of an actual history and physical, like a visit, we think roughly we could probably recoup about $150,000, which would cover that FTE for that individual. But it would also save ambulance time.
Right, so has there been any cost benefit studies on the reduction of costs on the MedAct?
So I would refer or defer to Paul Davis, the director of EMS, but the time we're on scene for these lift assists is 2 to 3 times longer, which means your ambulance or fire truck is not available for the next call. So it does free up resources. If we can refer that person, we'll say, yeah, the nurse practitioner or PA is gonna come visit you. They can put the ambulance or fire truck back in service and go to the next call when our system's pretty stressed for volume at times. So it does help kind of offload the ambulance unnecessarily.
And where would these people be housed? I mean, like at medic facility or?
This would be in our office at the dispatch center. That's where the medical director's office is right now.
Okay, thank you.
And Commissioner, I just wanted to follow up. I think those are some of the questions as this came forward for our review internally within the organization. Those are some of the questions that we need to make sure we have answered before we launch, make sure all the systems are talking, make sure that the concept's going to work, and what are our goals. So
Right, yeah, I would like a cost analysis on it as far as getting some input from MedAct to see if this is actually going to reduce our costs there, and then we would provide better service.
And I think it's on the unfunded list just for that reason, so that we can continue to work the program and make sure we have all these questions answered.
Okay,
So,
thank you.
Ms. Albrand?
Thank you, Mr. Chair. Before you go away, being in the healthcare business previously, I can tell you that this is going to save a lot of money. First of all, it's not just people living independently in their home, it's people that are living in independent living communities, it's people that are in assisted care. And sometimes, sorry, Commissioner Myers, but sometimes this is that it will show people in frailing health. So you, but because you would track, if you're in a community, you kind of track that, and you're going to see those numbers. So, that we're just now getting into that navigation system. A lot of the hospitals are already there, and they've already seen significant improvement. So, thank you for doing that. And also, Dr. Peterson, I have received numerous calls, and when you have someone that has committed suicide or someone that has been murdered or somebody that has died in your home and you're waiting for somebody to get there, an hour to 2 hours can be forever. And so it is something that's very much needed, and I applaud your staff for the work you've been doing. But I've received some of those calls. So thank you for that. And Dr. Ori, I'm not done yet.
Mr. Allenbrand, I just want to say I didn't need assistance. I was the person assisting others. Now,
Oh, good.
I could need
Okay.
assistance here in not too long a period, probably. but
Well, I made a note.
Well, it's old football injury.
I made a note here for Ms. Hanson to give you a call about the wellness. But, I was just sitting here, just looking at what has happened over this past year, and I know it's created a great burden on your staff and yourself, and it hasn't always been fun. But the survey definitely showed how important it is. And to think about, I was just jotting down a few things, and it's also about relationships and partnerships. So you now have partnerships with schools, you have partnerships with the healthcare community, helping those nursing homes, assisted living with infection control by having somebody, I think that person is with the University of Kansas Hospital, and I've heard directly from some of those communities that how much help that showed them. Instead of somebody coming in and criticizing them, somebody coming in and saying, hey, you might think about doing this a little bit differently. And then also partners with owners and CEOs of those communities. So you continue with those talks. The partnerships with the hospitals. And the mobile unit, going out and visiting, I was with you on some, going out and make those calls, getting those vaccines for those people who wanted it, creating that relationship. And those people, I remember us going into one community and they were clapping and I thought, is somebody else here? They had received their vaccine. So you created a lot of good things, and that's going to help in the future. So thank you for that.
All right, well,
Thank you. Yeah.
again, what was it, last week, Doctor? The appreciation activities for your public health staff?
Yes.
And so congratulations again for your leadership and all the staff in your department. Are there any other questions on this item? If not, we're going to take a 5-minute break and come back.
Thank you, Mr. Chair.
They just left me. We'll start with developmental supports. Jack Habig, is the budget analyst for that. I will mention in the detail pages that are in your notebooks, I just noticed that our copier apparently doesn't have the light yellow ink, and on 014, the graph only shows one little pie slice. The rest of it is yellow. It will be corrected for the
Okay.
final budget book.
I mean, online you can see it, it just
Right.
didn't print, so.
The numbers are below, so.
Okay?
Jack?
Good afternoon, Jack Habig with the Budget Office. I'm joined up here today with Rick Marion, the Board Chair for Developmental Supports, and Chad Von Annen. You'll see by your chart there on the screen that their budget went up from 25.2 million to 26.38 million, and local support went up from 15.58 to 16.96 million. And that is primarily due to the budget parameters for salary and benefits. And you'll notice that FTEs went up from 301.66 to 303.66 in 2023. And that is due to 2 FTEs that were added outside of the budget cycle last year. And with that, I'll turn it over to Chad.
And I'd like to introduce Rick Marion, the board chair for JCDS. He has a few comments.
Good afternoon, Commissioners. At the outset, I'd like to thank Joe for lowering the podium just a tad for me. I appreciate that. On behalf of the JCDS Governing Board, I'd like to thank the Board of Commissioners for your ongoing support of JCDS and the people with intellectual and developmental disabilities. The past 2 years have been heavily focused on the health and safety of the people we support through the COVID-19 pandemic. Fortunately, programs have come back online and returned to normal, as you'll hear more about. We are able to provide high-quality services in large part due to the commitment from Johnson County government. So again, thank you very much, Commissioners, and we really appreciate your time this afternoon. And again, I don't know whether the podium will go back up for Chad, but we'll find out.
It doesn't need to.
Well, thank you very much. Thank you very much, and thanks to the board for their leadership and their commitment to our disabled community. Thank you very much.
Thank you, Chairman.
We couldn't do it without you.
Thank you, sir.
All right, good afternoon, Commissioners. Mr. Chairman, Chad Von Annen with Developmental Supports. I want to call out a few things as we get started through this. First of all, on performance measures, you're going to see some of these are not filled in and they're gray. As Commissioner Ashcraft has had an opportunity to observe over the last few months, we've been having an evolution of our performance measures. We're trying to make sure that what we're measuring, oh, no problem, actually is meeting what our mission statement is. And part of this change, we've had a couple opportunities with our board to look at both our new electronic health record system and our change in accrediting agencies, which is now the Council on Quality and Leadership, which is heavily focused on personal outcome measures. And so through COVID, we started working through how do we adjust these metrics. So for the budget process, you're going to see some things that aren't quite filled in yet, but that's largely in part to what that's from. You can see the 4 main categories we look at: financial stability, the customer satisfaction, which again will be getting more into the personal outcome measures for people, operational effectiveness, how effective are our programs as we provide services, and then of course employee engagement is something we're always looking at. I know in the past week or so we've had a couple opportunities to talk about things that we're seeing within JCDS. Retention is something that we're looking at, as well as recruitment, especially for direct support positions. And what we've looked at in direct support profession turnover for us has been around 25%. And again, as I've mentioned to you all before, that's good compared to the field, but we would like that to be better. Our biggest issue lately has been more in terms of getting a large applicant pool for those entry-level positions. And if we want to move on to I feel like some of the pieces that we'll talk about this afternoon, we've talked with you about recently, again, in terms of challenges. Big things that have happened for us in terms of accomplishments, probably the most significant has been around advocacy in the last year. Most of what we do is funded through Medicaid, and so that federal-state partnership is, of course, important to setting the rates that we receive. The legislature passed and the governor approved a budget with a 25% increase in our reimbursement rates. That's historic, and I think it's a reflection, as we've all talked about, the need for qualified and quality direct support professionals in our field. And I did want to mention, along with Chris Linane, who's our Chief Financial Officer here, Shelley May is our Deputy Director at JCDS, and she's also the current President of InterHab, our state association, who did a tremendous amount of work on this effort during this legislative session. There's also been some progress on the federal level where there was a 10% increase in federal funds for home and community-based services. That's a pool of funds that the state has distributed for workforce recruitment and retention efforts, again, focused on those direct support professional positions. We're using that in having quarterly bonuses for existing staff and also for referral and recruitment bonuses as people sign on. One of the big accomplishments, as you heard some this morning as well, has been in competitive employment. We have 138 people who are working competitively right now or seeking employment. That number, as I think we've talked about a few times, dropped down to 17 during the pandemic. And so it has come back strong. It's, again, as this is a program that is available for people who are on the Kansas waiting list for services. And so we do see increasing demand there. And again, as I mentioned earlier, implementation of our new electronic health record system and our accreditation for council, with council on quality and leadership, I believe is going to help us continue to make data-based decisions in a field that historically doesn't have that. When you think about working with people with lifelong disabilities, there's not a robust set of performance outcomes in this field outside of something like competitive employment. In terms of challenges, again, direct support, recruitment, and retention, it's related to the second bullet. I think for a lot of caregivers, this idea of fatigue through the COVID pandemic and how we've had to adjust how we do things, we're still, I think, dealing with some of that, and I think that also leads in part to some of our retention challenges. The waiting list for services continue to grow, both statewide and locally for some of the services we provide. We are also advocating with the legislature to take a look at how we operate our service system in Kansas. We have one set of services for people. It's an expensive, large program, and so what we're hoping to achieve are potentially some smaller services, maybe smaller in terms of less costly, but could maybe help some of the 900 people who are on the waiting list in Johnson County, for example. And so that will be determined by the legislature. Again, we see increased demand for case management, behavioral health, and employment services. And lastly, housing has, as you all know, it continues to be a challenge in our area. Friends of JCDS has had some success in this area. We have 18 homes that are open. We have one that's being renovated in Gardner right now, and then we have one that will be built, is still on schedule to be built, start later this summer in Shawnee. The challenges are becoming they're becoming more and more difficult. We actually looked at a house earlier this week, and just the cost of, as you're all well aware, of getting into a home and then for what we do, renovating it, making it accessible, making it suitable for people to age in place. It is becoming more and more of a challenge. So we hope to work with policymakers both in the state and then locally on how we can help address this from the disability perspective. And with that, I would be glad to answer any questions people have. We don't have any requests. As you're well aware, we discussed our critical needs this morning.
Okay. Ms. Fast.
Yeah, I know last year you said Kansas legislature had some meetings about autism, and how, because they bridge, children and growing number of children, adults with autism. There are mental health center needs, and they also have, our intellectual disability waiver needs. So do you see the state moving? It would be a new waiver, or would they expand the SED waiver, or what are your thoughts on that?
Yeah, so two things. One, there was an interim session on intellectual and developmental disabilities, which I don't recall happening before, and so that was nice to be able to set aside. And I think it did set the stage for the workforce issue to be, be addressed through this session. The other part of that, though, was there was talk about making a task force on IDD, which is similar to, I think, maybe a couple years ago where there was a statewide task force on mental health. And so I think that's one of the objectives, to try to look at additional services. Now, if you look at the crisis side of things, there, at least through the process, has been a component of IDD crisis stabilization in the 988 legislation. And so when the legislature comes back next week, we'll have to see if that's approved. And if it is, then we'll have to just see how more for the crisis side of people with autism who go across both systems could be addressed. Hopefully that helps.
Yeah, I think, I know and thank you for, I've had a number of families, and thank you, and I think that, I don't know, at some point I wouldn't mind to convene a meeting with these families with Tim and yourself. Commissioner Hanslick was on part of one of, and it's a good learning process for me, too, how to be a better voice.
Yeah, yes.
Mr. Ashcraft.
Thank you, Mr. Chairman. Mr. Von Onum, I appreciate you talking about the personal outcome measures and the work that you've done. I know it's been an evolution, and you've stepped up and have had support with that. Do you feel generally, and I'm sure it will be tweaked, but generally that the measures that you're presenting here will be the measures that matter going forward?
Yeah, I think for the most part, but I do think that, as you mentioned, there'll probably be some tweaks along the way.
Yeah, fair enough. I mean, it's a significant shift from what you've done historically, so I commend you for that, and I think it does get to some core outcome expectations for the clientele that we serve. So, a question though, I was looking at the business objectives, or whatever you call the little color chart, the scorecard, and you still have financial stability in yellow, even though you've got reserves that are robust. I just question kind of the rationale, because a couple of them, 3 of them were green last year and they're yellow this year, or one was red to yellow. But the question I had was, last year, under employee engagement, you had increased employee engagement as red as a significant issue that needed to be addressed, and it's not even presented this year. So what's the thought process there?
What drove the red last year is, if I believe you have the more detailed page, it had to do with the staff development hours. And so that dropped significantly last year because of COVID. And so that kind of skewed that measure to.
I think it was the engagement survey.
The engagement survey is a part of it. We haven't done that. We rely on the county engagement survey, and so when looking at what that will look like in the future, we would definitely incorporate that. It's a topic of conversation at JCDS whenever we do it, but I don't know if it's been reflected directly in the past. And in terms of the financial, you're right on the reserves. It's so far outside of what our target number is that we felt it was appropriate to be yellow, because we need to plan to do something with it.
Thank you.
Chad, a couple of questions. Your independent employment of clients, is that improving? Where is that at?
Yes, that's where we have 138 now, and I would be remiss if I didn't mention, if any of you are interested, on Saturday we have 9 graduates from the Project Search program who will be graduating at Johnson County Community College at 2 o'clock. But yes, we continue to see growth and interest in that, and we actually had to pause referrals last fall for 2.5 months because we were at capacity. So I do think as we see more kids come through the school system, there's definitely interest on their side. There's more awareness of the services we provide. So I would expect that to continue to grow.
One last question. I know there are other agencies, I would call them independent agencies, who offer services, and they get their funding directly from Medicaid or or other sources. How many of those, at one time we had 70 or 71, 75. Can you give us, do you know what that number is now?
Yes, we have 76 right now, service providers. Now, many of those are smaller. They may serve a few people. So in terms of larger agencies, probably around 20 to 25, and focus in different areas, day in employment or residential services.
And do you have a number on the number of clients that are served by those 76? Any other?
We have total in services in Johnson County, 1,450. I would have to break down because it's by different services. To give you some perspective, at JCDS, we are, between our three programs, around 550.
Okay, thank you. Thank you. Other questions? Okay, thank you very much.
All right, thank you.
Move on to mental health.
As you can see from the chart for mental health, their total budget goes up from 35.13 million to 44.25 million. And their local support goes up from 22.0 million to 23.78 million. That is the net impact of 3 positions that were added through the budget process. Some other non-personnel RARs and a number of positions that were added outside of the budget process. You'll see that their total FTEs go up from 346.38 to 382.63. And again, that is because of 3 FTEs added during this budget process and FTEs added outside of the budget process. And with that, I'll turn it over to Tanner Fortney to discuss the performance measures.
Tanner Fortney, Mental Health. So this is our organizational scorecard. I know you're all familiar with it. This year, we've actually seen some improvements in a number of different areas. One of the ones that's probably the most significant has been our financial position. We finally, prior to the COVID pandemic, as I think many of you know, mental health for a number of years really struggled with being able to keep a fund balance that would be within county policy, which is supposed to be 8 to 12%, and I think in 2019, we were at just over 3%. And fortunately, due to a number of different changes we've made within some of our programs and our management structure, as well as funding that we've received both during the pandemic, as well as different funding sources we've pursued since then, we're really pleased to see that our fund balance is well over 16%. So that has really been a big accomplishment. But you can also see by looking at our scorecard that in most of our clinical areas, such as client satisfaction and quality care, we're also performing very, very well. Really the only areas that we're really showing in terms of those key performance areas themselves is really improving staff satisfaction and engagement, and a lot of that has been and I think really what a lot of that comes down to has been during the COVID pandemic, with a lot of the shutdowns and a lot of the remote work and not really being able to do a lot of the same activities that we need to do with staff. Things really did suffer a lot in that area. And there was also a number of measures that we've had to rework because during COVID, we really didn't do a lot of community engagement and outreach. A lot of those activities were put on hold. And so while we still are going to look at those, we've developed some different measures we've started to look at on our scorecard to be able to better look at how we're building community partnerships and such. So with that, I'm going to turn it over to Tim.
Thanks, Tanner. Tim DeWeese, Johnson County Mental Health. I'll go ahead and start since Tanner identified on our scorecard our big red dot, which really has to do with staff satisfaction. Really, that has to do with our workforce issues. It's really the central challenge that we're experiencing at the Mental Health Center. When we look at last year, we had a 27% turnover rate. We're roughly at 30 positions that we currently have vacant, and that continues to kind of just stay the course around 30 positions that we're continuing trying to find, to engage, to recruit appropriate folks to be able to work in those positions. And it's not uncommon to hear that from all of the other, we've heard that from the other human service organizations. Workforce is absolutely a thing that we have to pay attention to. We've really tried to focus, I've tried to focus on looking at more of a long-term effect, and that really has to do with working with local junior colleges as well as high schools to make outcoming seniors and maybe even juniors in high school understand what public service is, what public health is, what public mental health is, and introduce them to the notion of serving in those capacities as a career. And so I think that's one of the ways that we're going to continue to move and address that challenge. The accomplishments this year, there are a number of accomplishments, and we've been able to share those with you all throughout the year. But the three that I think are most important, or that I'm most proud of, is we just recently completed our second CARF survey, and we expect that we'll have a high review rate and achieve the 3-year accreditation, which is the highest accreditation that you can get. We also submitted our application to become a certified community behavioral health center, and we expect that will go into effect July 1 with the new fiscal year for the state. And then finally, we were late last year into early this year, we were selected as a National Suicide Prevention Lifeline site. And that's worked perfect for us as we've then looked at transitioning into our 988 call center. And so we have our 988 call center. We are in the process of rounding out that full staffing. Once we get everyone on staff trained, then we'll start the process of shifting our current call center, which is at the mental health center, into the emergency communications center, so that it will be centrally housed and we'll be able to provide services. And I think it takes us one more step to what was talked about earlier in making sure that we have the right people respond to the right situation at the right time. And that will be able to be more beneficial financially to the county, but I think it'll also improve the care for our citizens. So those are really the three accomplishments that are most impressive. And I think we're also then move into the RARs, and I'm going to let Tanner talk about the first three, and then I'll come back and talk about the last three.
All right, so on the first three RARs, the first one being the primary care and supplemental psychiatric services contract. That was the contract that we presented last week, and you all took action on that this morning. And what that was about is that's really adding the services that we are lacking in order to achieve our CCBHC certification. And as Tim mentioned, we're going to be starting that in July of this year. And so what we're really asking for in that is we have a $2 million tag on that, but what that really is we're not asking the county for any funds. That's all going to be funded through that enhanced PPS rate that we'll be receiving. But as you see, a lot of times when I come before you and I have to present some sort of a new service or new request, I'm usually asking you to reclassify our reserve authority. Well, this is basically building in that authority into our budget so we don't have to continue to do that. And even though in the first year we're really only looking at probably about $300,000 through the remainder of '22, and probably between July 1st and June 30th of next year, we're looking at about a $550,000 expenditure. This $2 million gives us the ability over the life of the contract as we move forward, if we need to add additional staff and we have the revenues to do it, we can go ahead and do it. We don't have to keep coming back and asking to reclassify reserves. So that's really the logic and the thought process there. The next two items are related to our EHR system. The first one is related to what's called the NX upgrade. This is essentially a matter of just technology changing. When our EHR system, which is MyAvatar, was first developed by NetSmart, I believe it was developed using a Java platform, and now all that's going over to HTML. And because of that, they need to upgrade that system in order for it to continue to be viable and communicate with a lot of their patches. And what that is we're asking for a $100,000 use of our reserve funds in order to be able to pay for that. So again, we're not asking for any county general reserves to be able to fund that, or any general funds. And that is a one-time cost. But even if that were not approved this year, it would absolutely have to be done by 2025. That would be the drop-dead year to do it. But we would like to go ahead and do it as quickly as we can, since we have the funding right now to do it. And then that ties in with the next item, which is the Avatar cloud hosting. So initially, when we started moving over to the MyAvatar system back in 2014, everything was set up where we did our own hosting. It's being done by the county's DTI department, so they run and manage a lot of the servers there. But the problem is that that is a very labor-intensive process at times, especially when we have issues where certain things happen on NetSmart's end, and sometimes they're saying, well, it's not an issue that we can really resolve. You need to work with your internal hosting from your DTI department. So then we talk with DTI, but it can just be a big challenge. And by going to the cloud hosting, not only does that save a lot of time and a lot of resources with the servers and the technology that DTI has to use, but it also puts all of that responsibility for maintaining the stuff on the cloud at NetSmart's responsibility. So we can make one call, we can use one group who, it's their proprietary software, they're able to do the troubleshooting for us. It would be much, much more efficient to be able to go that route. So with that, I'll turn it back over to Tim.
So the last three requests for additional resources have to do with three positions that we identified as our most in need. They're all going to be funded through our increased revenue, so there won't be additional tax dollars requested for those. The first is the FTE nurse supervisor. As we've continued to expand our services into the jail and into community corrections, we have more nurses, and we just need to be able to supervise those nurses in a manner that's consistent with best practice. Second is a full-time FTE dedicated to what we call the Community Behavioral Health Team, which I think you heard about earlier today. That is a collaboration between Johnson County Mental Health Center and Johnson County Developmental Supports, so where we work with individuals who are duly diagnosed that have mental health issues as well as intellectual disabilities. And this position is, as they expand that team, we'll need to provide additional clinical coverage for them. And so this will dedicate a full-time FTE, one clinician, to provide services and support to that team. And they will be integrated in that team, so they'll be located on-site with the team. The third is then a quality assurance specialist. As we continue to expand and as we continue to see the number of our interactions and encounters increase, we want to make sure that we do internally a good job of managing that and making sure that when we submit claims that they're accurate, that they don't end up coming back. We have a very low return rate for our claims, claims processing, and that's because we have a good Q&I team. And we need to make sure that we stay on top of that, so adding an additional QI specialist will allow us to make sure that we're providing those claims in the way that we need to accurately so that we don't have those come back. And with that, I'll stand for any questions.
It's fast.
Yeah, I wasn't quite sure when Tanner presented last week. So on the primary care, is that going to be located at one of your buildings, or will you refer they go to their offices? How will you do that?
The whole purpose and the whole idea behind CCBHCs is for us as a community mental health center to provide at least the ability to assess and treat those conditions that are typically associated with individuals that have severe and persistent mental illnesses, those chronic conditions. And so we have created 2 clinics within our medical clinics. So we have a medical clinic in Olathe and one in Shawnee, and both those medical clinics will then have primary care located in them a couple of days a week. So 3 days a week they'll be in Shawnee, and then 2 days a week they'll be in Olathe. So people can come in, get their health care addressed, as well as then their mental health care. As I've said for a long time, it does us no good to help someone manage their symptoms of schizophrenia if they walk out of the door and have a heart attack. This way, we're able to provide the services and support so that they get the services that they need for those mental health conditions, but that we also are addressing those primary chronic conditions that are always associated with serious mental illness.
So the audit, they've been working on that. We were going to have a committee of the whole on the workforce, right? I mean, is that we're looking at June or when to talk about, the workforce issues with mental health?
I'm not sure when that's scheduled, Joe. Do you?
Yeah, I'm not sure either.
I'm looking at Joe Connor. Do you have an idea?
I do not, and somebody was in my ear when that question was
Okay.
asked.
You can look at me, and I don't have one either, so.
You know, we have continued to look at different ways structurally within the mental health center to see what we can do to be more competitive. And, you know, we've actually had some positions reevaluated, which has gone really well. So we've been able to work with HR to get some of those things done. I haven't spoken with the county auditor in at least a couple weeks to find out where they are in that process of presenting that to you all and sharing their findings and then moving forward with the next steps. And that's probably the best that I can tell you at this point.
I will say that I was able to participate in some of the input sessions that Tim had, which were just incredible. He had all his staff Zoom meetings talking about the workforce issues. Many people talked about flexibility, which I think is something we need to look at countywide, to have more flexibility in their work schedule. The other thing people brought up is about the working conditions, and that is something this commission needs to look at. That Olathe building, mold, the rain, you go in there and there's buckets everywhere dripping. There's not space for modernization of mental health services. And so I really hope this commission spends time on this. It's been put on the back burner, taken off. It is time to put it on the front burner. And when staff and workforce is saying that is a huge issue that impacts their quality of work and productivity is key.
I'll just mention that Tanner and I will also be back here next Thursday as part of facilities presentation because we have a healthy piece of that presentation as well.
Right.
Okay, thank you. Ms. Hanslick.
Thank you, Mr. Chair. First of all, I'm looking at our last audit committee report, and it looks like the mental health center report's supposed to be released sometime this month. So that's what it says there. Two questions for you. One is on the funded RARs, the 1.0 Community Behavioral Health Team Clinician, it says funded. I wonder if you could explain that. And then the second question is, under the unfunded, is an AOAS team leader. It looks like that's a position to work with the juvenile drug court, and wondered if you could talk a little bit about that. So those are two
Yes,
questions.
all three of the positions that are in the budget that are funded are going to be funded by additional revenue that we've brought in. So that includes the CCBHC clinician as well as the nurse supervisor and the quality assurance specialist. In regards to the two FTEs that weren't included in the budget, both of those positions, the first, the AOS, the outpatient ACT, or our Adolescent Center for Treatment Outpatient Services, that team leader is currently, as you all may recall, as we shifted during the pandemic, we shifted so that we could focus on serving more adolescents from Johnson County. We developed an outpatient program so that we could serve people in their homes and not necessarily require residential treatment. And that's gone really well, and we're filling those caseloads up, and it's to a point where we need to have that additional team leader be able to split that off so that we can do that. While it's not funded in this budget, I would expect that after July 1 in our CCBHC credit certification, we will see the funding. And so my plan would be to return to you with an immediate action request as I'm able to fund some of these additional positions to come to you and ask for your approval to move them forward. So while they're not in the budget, and they're not currently funded, I believe Tanner and I both feel like we can come back to you all later in the year when we are certain of the funding stream and what that funding looks like so that we can add those additional positions.
Thank you.
Ms. O'Hara.
Thank you, Mr. Chair. Okay, so in 2022, we had, we added one FTE for homeless outreach case manager. And so I just need a little bit of an update as to how that has been successful and how many people do we have on the mental health side that's working with this population?
So right now, we have 2 people dedicated to the homeless outreach. We also, throughout well, we did it initially through the pandemic, but we've continued to expand that, where we have what we call a safe place parking, which we've worked with the Shawnee City and the police to allow people to park in our Shawnee location. We have porta potties out there, and so if they have a car, they can park there and receive support and services from the mental health center, but they can park in a safe place and stay there overnight. The police appreciate it because it's all in one location. It's not throughout the city of Shawnee. And so those 2 people really have been able to focus on outreaching those individuals as well as working with the 1020 shelter. They spend a lot of time at the shelter over the winter, identifying people that have mental illnesses and that could benefit from services. The challenge that we have is housing, and you all have heard that over and over and over. We can provide the level of care someone needs, but if they don't have the ability, or if we can't find them affordable housing within Johnson County, then it makes it even more difficult, and that tends to be the biggest barrier to getting people out of homelessness, is being able to find adequate housing. This year we did see an increase, a tick up, because we actually added through the Section 8 voucher system. We added, I think it was 64 vouchers over the course of the year. So that was huge. Those were the first addition to vouchers that we've ever had. The problem with that is that there are fewer and fewer landlords willing to take Section 8. And so we have to look at how we can do more and more landlord development, and so that's what some of that outreach, not only are they outreaching those homeless folks, they're also trying to find a way to outreach landlords that would be willing to rent to individuals that we have to serve.
Okay,
And I could give you specific outcome data for those 2. I don't know them off the top of my
Yeah,
head.
and I know that we've shifted now over to a housing coordinator in planning. So will we be having coordination between the housing coordinator and mental health outreach?
Absolutely.
Okay, and then this information that I have from United Community Services, it says, this was 2019, Johnson County Continuum of Care conducted 2019 point-in-time count on night of January 22nd, and the number of households that were in emergency shelter was 85, and total number of people 129, number of children 40, and on down. And unsheltered, it showed 28 households, 39 people, no children in those. And and then in 2020, it was somewhat less. And again, this was on January 28th of 2020. And then in 2021, it was, again, less than what it was in 2019. So I'm just trying to understand, these are the numbers of an actual count. And then I hear other numbers that are being presented. And I just would like to be able to understand the scope of the problem. It seems like that there's just a whole lot of numbers running around, and I would assume that the United Community Services numbers should be fairly valid, but then I know that there's other numbers stating that there's 1,000 homeless children in Johnson County. So from the mental health side, if you guys could help me understand some of these numbers, I would appreciate it. And you don't need to discuss it right now.
Absolutely. I'll be happy to do that. And
Okay.
I think that one thing that's important to realize is, yes, the UCS numbers are accurate for that night. But they're also accurate for how the federal government defines homelessness. And they do not consider people that are precariously housed, meaning that they really don't have a home, they just have somewhere to stay that night. They don't consider them homeless. Or if there are people doing what we call couch surfing, so kids, high school kids, elementary school kids that are just surfing from couch to couch to couch with friends, staying with friends, they're not considered homeless either in that count. And so the reason that you see multiple numbers is because depending upon how you define homelessness, you're going to get a different count. So you can go to UCS and we can get that homeless count that's done on a single day, and we use the HUD definition. You can contact the school districts and ask them how many McKinney Vento students they have, and they count, the way their definition operates is a lot wider. It not only includes the people that are recognized federally, but also kids that are precariously housed are also included in that count as well.
And how do schools, how do they accumulate that data?
You know, I would have to find that out.
Okay,
'cause I don't know.
I'm just curious
I'll
if they
let you know.
do, how they are identifying
I think the easiest way is that the person wouldn't have an actual address, a home address that was their kid's address that would be in that district. But, you know, let me find out specifically, and I will give that
Okay,
information.
yeah, I'm just curious. Thank you.
It's a good.
Tim, I have a question. It's a little off the subject, and maybe it's one you can't answer, but the situation that took place here a few days ago with 14-year-olds, 13-year-olds being involved in a fatal shooting, is there national, regional, or local? What's your assessment? Is it inability to handle anger, or is it just simply we didn't want to pay for a sack of marijuana? And are there programs for those young teenagers that might make a difference? I don't know, and maybe there's no way to really address that. I don't know.
Yeah, I don't know that there's any way that I could specifically address that situation. What I can say is that I think that there have been challenges in looking at how we address the juvenile justice system. And I think internally, here in Johnson County, we worked more close to figure out how we can do that. But we also know that there's been legislative action that has identified funds and then not necessarily delivered those funds in the areas that they needed to. So in my mind, the way that we create opportunities for those kinds of things not to happen is to focus on preventing those things. And so preventing those things, making sure that people have access to mental health care, whether they're in the justice system or not, but being able to do those early interventions and working with kids in a more intensive way.
Well, is there, perhaps some of those teenagers don't have parent supervision. I don't know. Perhaps some of them do. But there is already opportunity for parents, if they have concerns, to contact your department for assistance.
Absolutely, and I think that's the key, is that it can't just be focused on the kids. It really has to be focused on the family unit and that prevention, those prevention efforts early on. And so I think as we look at continuing to develop areas of focus within the Community Mental Health Center, I think there are two. There are those for older adults that I think we see that growing population and needing mental health services, because if you look at the suicide rate, the one that stands out to me when I look at the numbers is that of older adults. Again, middle-aged white men, that's the highest demographic. And then the other area is within those youngsters that are having difficulty in school. Those red flags, we see all of the indicators. We just need to be able to make sure that we connect those youngsters with school. So it's important that the mental health center continue to develop the relationships with the schools and be able to have a good system to make sure that they can refer people, and we can and communicate that to the schools as well.
Thank you. Mr. Ashcraft.
Thank you, Mr. Chairman. Mr. DeWeese, I'll direct this to you, but I hope Mr. Fortney is paying attention. I just wanted to offer comment. I am continuously impressed by the subtlety in the linkage you have between your performance measures, your key indicators, and your goals and objectives. You and Mr. Fortney and others have been working on this. It's evidence. I see the evidence of it here. I'm very impressed by it. One clarification, because as Mr. Fortney had pointed out, I believe it was Tim, you had one area of concern, improve staff satisfaction and engagement. Does the 2023 budget that you're advancing address that issue affirmatively? So next year when you and he stand up here, all we see is green? And I guess I'm trying to put you on the spot, but that is a fly in the ointment.
Right. I think that the budget that the county manager has put forward addresses a number of the things across the county in regards to compensation, compression, all of those things. All of those things will absolutely impact the community mental health center and create more of a, I think, us moving in that green as well. I do think that, as I listened, and Commissioner Fast listened in on a few of those listening sessions, I think there are also things that we structurally, organizationally, meaning the mental health center, can do as well. Looking at how we can support people to be more flexible in their work schedules, things like that. The challenge is that we have to be flexible to support the staff at the same time making sure that our number one focus is our client need. And sometimes those come in conflict. And so what we want to do is find situations where we can answer this question. Is it in the best interest of our client? Yes. Is it the best interest of the agency? Yes. And is it in the best interest of the employee? Yes. And so we're going to work as a team to figure out how we can get more yeses, so that we can move that towards that green. Because we really need to make sure that while we support our staff and we allow that flexibility, that we're also making sure that we meet the client needs and that we meet the agency needs.
One follow-on, Mr. Chairman. Mr. DeWeese, do you intend to continue to use what you describe as the annual gauge survey to measure employee engagement? I noticed that it's an annual, but we haven't done it for 3 years, and we have used it in the past. Is that something we'll continue to use? Or
It's my understanding that we're in the process of looking at how we'll do that engagement survey across the county as well. And then we also have looked at doing an internal just satisfaction survey internally as well, so that we can not only look at our data, but then utilize that larger engagement survey as well. So the engagement survey is more like that 50,000-foot level, and then maybe we can get a little more engagement from a more specific survey, specific to the mental health center itself. And so that's what we're looking at doing in 2023.
Thank you.
Ms. Allenbrand.
Thank you, Mr. Chair. I was going to share that I spent numerous years being on an advisory board and on the board at TLC, and I think they've changed directions now. But it was really hard to track how many children were homeless, because some of them lived in their cars, some of them, they hopped from bed to bed, in different homes, and, they would still have the same address. Some of them had credit cards. I was just amazed that parents just actually give them a car and a credit card, and they had a cell phone, but they didn't live at home. And I'm sure Mr. Myers, being in the school system, would see that, and it was really hard to track it. So sometimes carrying a backpack to school and using the showers there was kind of but it seemed like the kids always knew who that person was that needed help, but.
Absolutely.
All right, other questions? Ms. O'Hara?
Well, I just want to point out that I understand this issue of children in need because my youngest daughter came to my home when she was 10, and her brother accompanied her. And so I had two children, 10 and 12 years old, that joined our family at the same time. And they were very, very behind in their schoolwork. And I successfully homeschooled them within 6 months, and they were pretty well caught up. Unfortunately, my daughter's brother chose not to stay with our family, but I have personally experienced those issues of children in need, and it's heartbreaking. And obviously, I have a heart for that, and I just need to have an understanding as to how this data is collected and how we can best utilize our resources to address these needs. I want to make sure that we are getting the biggest bang out of every buck so that we can be effective. I mean, I did not know about the shooting in Olathe, and this is just shocking to me because three of my children went to grade school at Black Bob Elementary in Olathe, and this just like stabs me in the heart that this is occurring in this neighborhood that my older children grew up in. And absolutely, we have tons of issues to address, but if we don't have, if I don't have an understanding, if we as a board don't have an understanding as to how this data is collected and at what level, I mean, are they 17-year-old boys that are having an out couple of weeks with they're having a fight with their family and they're on somebody's couch? I mean, there's got to be so many differing situations, and how do we really get down to what we can do to actually address the chronically in need population in Johnson County? So I'm looking forward to our conversations.
Okay.
Okay, thank you.
All right, other questions? Okay, thank you.
Thank you.
Chair, I've had a request for a break, please.
Okay, all right, we've got, two left, libraries and parks, so let's take a 5-minute break, and we will come back and hopefully be able to finish those two. Thank you.
Thank you.
Yeah, I know, someone
Yeah, stopwatch. It's what? Okay.
My gosh.
Well, I don't know, I guess.
Okay, we are back from the recess. Next,
We're going to start with Culture and Rec, and we'll begin with Library. Ted Clemens.
okay,
Good afternoon, Chairman and Commissioners. The tax support for the library increases as a combined impact of the 10.07% assessed valuation estimated increase.
we were starting with Parks and Rec.
No.
Oh.
Library first.
Library's next on my list, so, okay, sorry, I misunderstood.
The 10.07% assessed valuation increase estimated, and then 0.10 mil decrease is the combined impact you're seeing on that chart. The FTEs decrease by 5.63. It's due to combined impact of the request for additional resources, which is a 1.0 FTE social media coordinator and 2.0 FTE clerks for drive-through services in Antioch, and then internal FTE changes to better operationally serve patrons. Lastly, the budget increases are used for salary and benefit parameters inside the budget, inflationary impacts to programs, transfers to capital projects, and I will now turn it over to the Library Board Chair, David Sims, for remarks.
Thank you. Good afternoon. My name is David Sims. I'm the chair of the Library Board of Directors. Thank you for this opportunity to discuss the proposed 2023 budget for the library. We recognize and appreciate a conservative approach to maintaining financial stability for county services, and we want to continue to support these efforts. I'm pleased to report that we have followed through on last year's proposed plan on spending. The Library Board wishes to thank you for your support of the Comprehensive Library Master Plan that was started back in 2015 and continues through 2023 and beyond. We have continued to focus on the community's strategic needs of education, community building, communication and operations, while providing the most accessible and convenient services. Throughout the challenges of 2021, we continue to provide library services at the lowest cost while also always looking for new ways to increase efficiencies. In the last year, we continue to focus on increasing convenience, especially in regard to digital services, both in the collection and programming. Here are a couple examples. First is Library On Demand, which is a virtual events platform for live, interactive events and pre-recorded programming launched in February of 2021. The platform has also hosted a virtual job fair in partnership with Johnson County Developmental Supports, the library's annual Writers Conference, and community feedback sessions for building projects. We continue to focus on our community through signature programs like 6x6 Ready to Read Early Literacy Initiative, the Race Project KC for high school students, and partnerships with nonprofits organizations throughout the county for summer reading book distribution, which is my daughter's favorites. Strong relationships with other county departments and agencies such as JCDS, the Department of Health and Environment, and the County Department of Corrections allowed us to expand library services to vulnerable populations, such as providing books and educational resources to residents of the Adult Residential Center and Juvenile Detention Center. And finally, next week, we'll be transitioning our ebook and e-audiobook platform, Access 360, to the popular and user-friendly Libby app, greatly increasing convenience at a cost-neutral rate. This careful and deliberate approach in planning and implementation continues to be successful, ensure that taxpayer dollars are spent wisely. The central staff space consolidation project has now been completed, and staff has moved back into the building all by the end of April of 2022. Additionally, we took the opportunity to greatly expand the kids area. We are now in the design phase for the new Antioch Library. Both of these projects remain on schedule and within budget. The Antioch Library's adjacency to the new community center will provide the community with many new and exciting opportunities. The shared parking structure is a testament to the City of Merriam and Johnson County's commitment to sustainability practices, governmental cooperation, and careful stewardship of taxpayer dollars. Nothing could have prepared the library board to deal with the challenges of the pandemic. But currently, all Johnson County libraries are fully open and available to the public. All locations, meeting rooms, event spaces, and study rooms are now available, and the library is open at pre-pandemic levels. I'm pleased to report that in-person programming will be restored this summer. We also plan to continue the new services that we established during the COVID closures, such as the online programming and the curbside service. I would like to take a moment to thank Facilities, Human Resources, Department of Technology and Innovation, Financial Management and Administration, and the many other departments that have helped and supported Johnson County Library in these difficult times. Our mission is to provide access to ideas, information, experiences, and materials that support and enrich people's lives. As a board, we are committed to providing a safe and welcoming environment for the public and staff. We are committed to following all safety guidelines and recommendations from state and local officials. We are committed to continue to challenge library staff to innovate and find new ways to provide library services in the new environment. Thank you again for your continued support of Johnson County Library and the Comprehensive Library Master Plan.
Good afternoon, Tricia Solentrap with the library. Our organizational scorecard, you can see that our staff efforts have resulted in mostly green. Our operational effectiveness is COVID recovery as citizens are more and more comfortable coming back into our buildings. And with the addition of in-person programming starting this summer, we expect to see that in the green this time next year. Some of the key points, challenges, and accomplishments from this past year. As our chair mentioned, all our branches were restored to full hours and services. This slide highlights many of our accomplishments specifically connected to the comprehensive library master plan, so dealing with a lot of our buildings, specifically Central Resource Library, reopened to full service after a year of renovation. Our partnership with the City of Merriam as we near the end of design development for the Antioch Library replacement. And then following that, the anticipated groundbreaking in late of 2022 or early 2023. That continues to be a strong partnership with the City of Merriam as well as county facilities. And then we've just entered the design phase for 3 of our smallest locations, DeSoto, Spring Hill, and Edgerton. We've completed a study and a series of community engagement sessions to really understand what citizens in those communities need and want from their library. Next slide, please. Looking back in this past year, we offered over 1,000 online programs with an attendance of over 90,000 citizens. This slide really focuses on some of the patron services. As our chair mentioned, Library on Demand allowed us to host online programs, which were incredibly convenient for citizens to take advantage of where and when they were able to. We also expanded our curbside services with over 66,000 transactions, and we have that curbside service in 3 different districts. So we have 2 options in District 1 at our Cedar Row and Leawood branches, and 1 in District 4 at our Oak Park branch, and 1 in District 3 at our Spring Hill branch. And that balances out our convenience ability for citizens to pick up their locations with 4 drive-throughs, 1 in District 2 at our Monticello branch, 1 in District 3 at our Blue Valley branch, 1 in District 5 at our Lenexa branch, and a newest in District 4, which is at the Central Resource Library. Next slide, please. And then some of the specifics that you heard from our chair as far as our digital collection. We're really continuing to be able to meet that patron demand. During COVID, lots of behaviors changed, and for our patrons and our citizens, reading and listening to things on digitally changed, and so we're happy to be able to meet that demand. And then we continue to look for ways to improve that patron convenience, whether that's curbside, drive-through, pickup services. We continue to expand our programming and looking to the future of a mix of that online, in-person, and those hybrid options, and continuing the implementation of our comprehensive library master plan. I'll turn it over to Sean Casserly now.
Thank you, Tricia. Sean Casserly, County Librarian. This is just a snapshot of where we're at with our capital plan today. As you can see with the red arrow at the bottom, it gives a status. We're just in completing the, looking at DeSoto, Spring Hill, and Edgerton, and we're into the process of looking at development process for Antioch going forward. Next slide, please. And again, this just as a reminder of what's funded and what's unfunded. On the left column is the funded projects. Those come from the 0.75 mil, or in the case of DeSoto, Spring Hill, and Edgerton, the use of reserves that we have managed to build up over the last couple of years. And finally, I'd like to introduce Dave Ratney just to give the financials on our RARs. David?
Thank you. Good afternoon, Board. Dave Rodney with the library. As you can see here, we have several FTE that we're requesting. 2 of these are 2 FTE are library clerks, 2 part-time, 1 full-time. We're adding some drive-through services at our Antioch Library Replacement project. The costs that are represented here are about 1/4 of a year's worth, as that facility is planned to be open in early 2024. What we plan to do, hopefully with this, would be to increase our exceptional customer service that we provide to this area and improve our patron options for being able to pick up library materials. This kind of connects back with some of our KPIs, or key performance indicators, number 2 and 3. which is premier customer service and hopefully increased transactions as a result of providing this new service at that location. And then the other request that we have is for a social media coordinator. That's a full-time position. What we see going on there is social media continues to grow, and there are a number of people in our community that are using it as a primary source for their information and finding out what things are going on in the community. And as that has grown in importance, we believe that there needs to be a better social media strategy and have dedicated resources to managing that. What we hope that we'll do is continue to provide premier customer services, so again, connecting back to our KPI too, and then also hopefully increase our resident visits to our libraries and increase our patron outreach attendance, which is KPIs 3 and 6, so key performance indicators there. So with that, next slide, please. And then these are the funded CIPs that we're requesting for 2023. The Library Capital Replacement Program is a little over $1.9 million. This is amount that goes into our various branches to help maintain and deal with deferred maintenance issues that we have across our system. The second is that DeSoto, Spring Hill, and Edgerton renewal projects that Sean had mentioned, and the use of reserves to pay for that. We're looking to refresh the physical spaces out in these community libraries and to try to provide better services for those communities. And then the last one on here is our comprehensive library master plan, and this is a little over $2.5 million that we're planning to put into that account, which provides for future cash components for projects that we plan to debt finance. So this is that cash portions of future projects. With that, I'll stand for what questions you might have, and again, we have other folks here too to help answer those questions.
Let me ask you, I have a question. When you look at the Spring Hill, Edgerton, and DeSoto renovations, and maybe it's changed since I visited the DeSoto branch, but it was basically one room, and that has not changed. So when you say you're updating, and it's not a very large room, what exactly is occurring? And the same way with Edgerton, fairly small. Help me understand.
So that's a really great question because it is a small footprint. One of the things we're looking at is how to reclaim space. So we're looking really closely at the staff space as far as their break rooms and what's needed there. Then we're kind of questioning particularly how we're offering computing services. So we have kind of a computer lab there and thinking if we can get space back by offering laptop lending so we won't have to dedicate part of that space. The two things that we heard from the community was they wanted meeting rooms, and with some of the proposed conceptual designs, we're able to add those meeting spaces in, so they may vary from 2 to 4 people, and maybe one space that will offer as many as 6. And then the other issue was looking at expanding hours. So we're studying ways that we could increase hours without increasing staffing costs, and there are some models that other communities are using and that we've tried experimentally using at the Lenexa City Center, meaning people are able to come in and pick up a hold even when the library's not open.
Okay, all right, Ms. O'Hara.
I have similar questions, and I know that I have spoken to community leaders in Spring Hill, and they have been lobbying, I know, for 2 or 3 years to do a partnership with the library to have a public library in the high school. And I talked to the chairwoman of the Spring Hill Chamber of Commerce and then the outgoing superintendent, and they both were adamant that they believe that a partnership could work, and that spending money on the facility that is totally inadequate, and Spring Hill can no longer be categorized as a rural area. That area has been growing. The housetops is increasing at an amazing rate. And so I think that this allocation of $1 million on these 3 facilities perhaps could be utilized in a much more efficient manner. It just seems like these are very small spaces, and $1 million for this. And the leaders in the Spring Hill community, they want a different vision. And I just would encourage you to visit with them more. The other thing is that I know that, and this Spring Hill is in my district, and then also the Blue Valley replacement on 151st, just west of Antioch. To even consider spending $55 million on a new library when we have all these other needs, to me, is obscene. We may need to have another library built, but to tear that one down or abandon that one and to build another a facility at $55 million, it's just beyond my wildest imagination. Just because you have a 0.75 mill levy for capital improvements does not mean that you must spend that. I believe that each mill raises $13 million annually. Is that correct, Mr. Chair?
It's about 13 million, yes.
It does not for the library because they do not include Olathe.
Oh, that's right. There's portions of the county that it does not. Olathe has their own library system.
So I can get that figure, but I don't have that file open.
But again, the allocation of $55 million for one building, to me, is building a Taj Mahal instead of really looking at the needs of the community. So I just would really, really encourage the library board to have another look. And I'm assuming that this $2.5 million is going to be used for preliminary design. And I would like for you to just kind of step back and catch your breath and reanalyze this. And that $55 million, that's going to explode in cost. I mean, that was an estimate 2 years old. I believe it was 2 years old. So, I mean, that is going to be even more. So those are my comments.
Okay, thank you. Other questions? Mr. Ashcraft.
Thank you, Mr. Chairman. Mr. Casterly, this may be one of the last times you're before us, as I understand it, at least the last budget presentation.
If I'm lucky, yes.
I thought there might be a comment. Go right ahead.
Well, very well, sir. So I'm not sure what your exit date is, but you've put in a lot of hard work and a lot of service to the library and the community, and I thank you for that.
Thank you, Commissioner. Appreciate it.
Particularly, though, on the budget, while we're here today, generally speaking, do you see that the performance measures that are in the dashboard, do you think they reflect the measures that matter in terms of library impact on the community?
Yeah, I think they, at a very high level, they do. We do a deep dive each month with the board and various other measures. But as a general picture about how the operation is running, I think it is. I think it's reflected in citizens' satisfaction rate, and I think the current citizen survey put by ETC kind of reflects that too. We seem to see improvements with that. You know, again, the trend is, as we're coming out of the pandemic, we're seeing door counts lower, and it's generally because we're not running in-person programming, but I think over the next 12 to 18 months, you'll see those restored.
And you'll be back to report on that?
It will be someone else doing the reporting.
No, that's fine. Specific questions, though, on slide 30, you've got a request for a couple of additional, or I guess 3 additional positions. And I was reviewing historically the staffing changes, and in 2018, we added 8 staff, 4 information specialists, a collections clerk, civic engagement coordinator, training specialist, and IT analyst. And then in 22, we added a security analyst and digital media specialist. And I was just wondering, based on the description that's on slide 30, there seems to be some overlap there. What am I missing in terms of the work that these new 3 will do that hasn't been or can't be accomplished by that staffing? And I know there's been additional staffing because you've opened a new library, but I'm setting that aside now.
Yeah, I think they're great questions. So let's take the easy one. The first one, the clerks. That is for the Antioch, and I think what the new Antioch library, and the present library does not have a drive-through, and their proposed library does have a drive-through. And since we're, I think, are opened about 74 hours at that location, that would say we need the staffing for those locations. We were pretty sensitive about staffing at the new location, and we had looked at conceptually 2 options. One was a 1-story and one was a 2-story. Staffing costs were one of the main reasons why we chose a 1-story building, but we could not provide a drive-through, that additional service, without the additional staff. So that's the explanation for the first one. The second one is really a result of the pandemic. What we found was that, particularly when we would do programming, and we'll take early childhood literacy programming, that more people were watching that recording after the program in the evening, which makes a certain amount of sense, putting their kids to bed, as we're watching it when we were doing it real time. And we realized that that was a missed opportunity, but we also realized that the expectations from the community is if we have an author visit, that people are needing to have or wanting to have that streamed and to give comments and ask their questions. We do not have the resources. Those librarians who've been doing those online programs will be going back and doing them in person. And we felt that a social media coordinator was the additional staff to manage the capacity to offer services digitally.
Very good, thank you.
Thank you.
I would just make one observation, and that's all it is, the rebuilding of the Corinth branch. I know conversations with Prairie Village have been off and on. I guess they're off now, but hopefully they'll come back on again. It just seems to me rebuilding a new library at the current site with the limitations on parking, et cetera, I would hope that a different location would be able to be secured, and hopefully with the cooperation of the city of Prairie Village. I think that's important.
Update on that. I will be organizing a meeting in June with Prairie Village mayor and city staff, and I've talked to Joe. They had a meeting 2 weeks ago with the YMCA where 200 people showed up. And so the city has begun a committee looking at this. They want to do a new survey. So they would like us to move, the library to move Corinth in front of the Blue Valley. So that will be what the discussion will be, because that's where it was. And then we moved it back because of COVID pandemic.
Okay. Well, hopefully they're able to put something together. You know, that was, I think, what we were all looking forward to. So anyway, that's good. Ms. Hansley.
Thank you. Yes, just a question about what's the status of the Lackman Library building?
The Lackman Library is in a position that it could be put on the market for sale. Again, we're just looking at the market for commercial, and we've been working with Bo on the assessment. The goal is to try and maximize the dollars that we can get from that, and so that's the position. There were maybe 2 years ago evaluations done. They're going to have to be updated, And to talk about the Corinth, the library is, we helped fund the first survey that was done along with the city and the Y. West Jordan and I have kept in communication. The library has always, whenever there's been an invitation to come and have this discussion, the library's always been in attendance. We're willing partners. It follows the same model that we've had with Lenexa and Monticello, and I think it's a great opportunity. It was always reliant on the city's timing and the city's being able to generate tax revenue to fund it, and the community's willingness to do that. But the library is certainly willing to enter into that conversation, and then I know the board stays flexible. When there are different opportunities, the board will annually reviews by policy, but will look at new opportunities as they come along. It's a matter of getting the timing right.
Okay, other questions?
On Cedar Row, I know that you're working on some renovations on the unfunded program projects. It says replacement, because I think you're in the process of doing, I know you did the roof, but doing a lot of infrastructure updates. So can you talk about that? And here it says replacement. What does that mean in terms of unfunded? Because you're doing a lot of interior renovations you're beginning with. Isn't that correct?
Yeah, we're doing, so as far as the CRP, we're doing work there. Some of the work is in just the paving, striping. Some of the work is done in the interior for refreshing. I think some of the work we've also done is on shelving and rearranging the shelving with the idea of providing people more window space than we've had. Does anyone else remember any of the details on that?
I think as far as the replacement, that would be, in this slide, that would be looking at a wholesale replacement.
Oh, it's like tearing it down in a brand new.
Yeah, but that would be years,
Oh.
you know. But that was just part of what was not funded originally with the mill increase. So that list of, so on down that list, a renovation of Shawnee, Oak Park, and Gardner. So looking farther out at those buildings.
I think one thing that was interesting, because when I've gone to all my cities to speak, I've asked about the local library. And the Leawood Library, it was fascinating to me, just the skyrocketing numbers of people that are pick-up, drop-off in Leawood, and how that was like the most used service in that library.
Okay, Ms. Hanslick.
Thank you. Yes, following up on what Commissioner Fast mentioned, I do think it's fascinating that really through the Johnson County Library app, which in the past week, I think I've made 2 people aware of that app. I don't know that everybody's aware of that. You have access to the entire library and beyond. And all you have to do is search for whatever book you want or video or whatever it is you want, and you can have it sent to whichever library branch you want, and you go pick it up. So even if the library near you is very small, you still have access to everything in the library. And I'm not sure everybody realizes that. And I love that app. It's a terrific app. I can put things on there that I want to save for later, because otherwise I'd have a stack of 20 books and never get through them in a short time. So, I think that's, as Commissioner Fast said, so many people now use the drive-through pickup, or they just run in and, like I know I do, I go into Oak Park, grab what's on the hold shelf, check out, and I'm in and out in 5 minutes. And I don't know if you have any sense of how that might continue to impact the use of actual library buildings for more in-person programming, because you can browse all you want on your phone, on your app.
Yeah, so that would then beg the question, why have all these buildings? Why not just have these big warehouses and are able to serve up material that way? And it's a really good question. What is happening particularly is we're not just, libraries aren't just a big, like book warehousing. So particularly with early childhood literacy, where it involves rhyming and song and physical movement, that has to happen. But what we're looking at is our meeting room spaces, and particularly of how heavily those spaces are used. And then when we were meeting with the architect AIA group, we were talking about, how do you sustain a community and how do you create a neutral space where people can talk about topics in larger groups, and that service is available to all your citizens without requiring payment, right, without having to pay for that. And libraries serve as that process. If you can think of it, a library as a physical manifestation of your democratic system, your First Amendment, your ability to gather, your ability to talk without influence of political bias. There's no other agenda that the library has than to provide that space for you. That, I think, is vital to a healthy democracy, and what we see is that that's heavily used, no matter what the topic is. And when we go out and reach to the community, and maybe we cast a wider net when we're looking at stakeholders, there are key stakeholders, but we also talk to the citizens about what they want and what kind of experience they want to have. It ends up being that they want to have both. There are some times I will go and sit down at a restaurant and have a wonderful meal. There are some times that I will drive through McDonald's, but I make that choice, and we find that citizens do that. And the other kind of thing from the KU study, just to remind everyone that for economic benefit, every dollar that you spend on libraries brings you an economic benefit of $3 back.
Okay.
So, again, I think it's a great investment in your community.
Mr. Ashcraft.
Thank you, Mr. Chairman. Mr. Casserly, I will ask you this question, but it's really not directed to you as much as it is Mr. Thompson. Over the past several years, there have been conversations related to our rather unusual library system, because the county has a system that has general tax support, but we also have an Olathe library that has its own independent general tax support for Olathe citizens. And there have been some questions about the services, and I know you cooperate fully or attempt to cooperate fully, and I commend that and support that. But there have also been some questions about, how should I say it, the indirect tax support that Johnson County Library patrons offer that benefit the city of Olathe. Have we had any further discussions, evolution in that conversation, or will we? And will it be resolved before Mr. Casserly retires?
Well, at the risk of getting into the library's business here, I will comment that those conversations do continue to occur. Is there anything pending at this point? No, there's not. Is it an issue of finding the right timing? I believe, in my opinion, with the city of Olathe to further those conversations, yes.
Well, I know they've evolved their library system, and it has been, but the conversations are continuing.
I believe there's a continued interest in exploring what that relationship could look like. Yeah, I do.
Very good. Thank you.
Okay. Other questions? All right. Thank you very much.
Thank you, Commissioner.
Okay, now we're going to do Park and Rec, and I'm assuming Jeff is on his way into the room. Oh, okay.
They're here.
I see you over there.
He's slippery.
Yeah, he teleported in.
And I'm gonna.
You better
this
not be late.
This first slide, Jeff will go back over, and it basically is showing, I do want to say that the proposed budget has parks at a reduction of 0.08 mil, so last year was 3.96. This year's 3.016, and this slide just gives you the breakout of the different funds within the parks, and again, Jeff will go back, I'll go back to it when he gets up there. The total published budget is going from 49.03 to 52.79 million. The tax to local tax support from 41.01 to 43.63. So you can see even with the reduction, they are having a increase in tax support. The budgeted FTEs go from 1.77.7 to 182.53. And there's just one request included in that increase, and the rest are seasonal changes that happen every year with the parks. With that, I'll go back to the first slide, and Jeff can start, or whoever he wants to introduce.
Good afternoon, Mr. Chairman, Commissioners. Jeff Stewart, Executive Director, Johnson County Park and Recreation District. And at this time, I'd actually like to introduce the Board Chair for JCPRD, Heather Rubish, who has some opening remarks.
Good afternoon, Commissioners. Thank you for the opportunity to speak with you and present the Johnson County Parks and Rec District 2023 budget. It is my pleasure to speak on behalf of the JCPRD Board. As Jeff said, I'm Heather Rubish, Chair of the Johnson County Park and Recreation Commissioners. I'm joined, as you know, by Jeff Stewart, who will review the proposed JCPRD budget after my remarks, our Chief Financial Officer, Noel Lewis, and also three of our superintendents, Susan Mong, Rhonda Pollard, and Terry Anderson. And I also noticed that my fellow Commissioner, George Schlegel, snuck in, so we've got a little backup. The Johnson County Park and Recreation District had much success in achieving many of our established goals and objectives. Our strategic plan and legacy plan continue to guide us in maintaining, protecting, and enhancing and expanding our beloved park and recreation system. Despite the challenging environment we have experienced in the last couple of years, major projects have started and completed as planned. In a short review of these, we've completed Phase 1 and 2 improvements at Mid-America Sports Complex. We've completed construction and first phase development and have opened the newest regional park, Cedar Niles Park, which many of you attended the opening for. We've completed a new amphitheater and ADA parking and other improvements at Ernie Miller Nature Center and a few others. JCPRD has made a number of planning efforts which will set the stage for future developments and improvements as well, including completion of the Theater in the Park concept plan, a public art master plan, engineering studies at Big Bull Creek Park, Sunflower Trail, Kill Creek Streamway Park, north of Kill Creek Park, and we continue to implement our natural resources and safety plans. In addition to our planned initiatives, JCPRD was successful in achieving many notable outcomes. The Johnson County Museum earned national accreditation from the American Alliance of Museums and received a National Award of Excellence from the American Association of State and Local Museums in its response to COVID-19. JCPRD was endorsed by the Mid-America Regional Council, has also endorsed the Mid-America Regional Council's Climate Action Plan and secured significant sustainable grants from the Children's Services Programming at the state of Kansas. The JCPRD Board of Park and Recreation Commissioners has established goals and objectives for 2022. We continue to implement our legacy plan through the management of 2022 approval of capital projects. Major projects include beginning Phase 3 of the Mid-America Sports Complex and complete improvements at Antioch Park's Helen S. Cuddy Rose Garden. We're completing construction of Meadowbrook Park Phase 2 developments and beginning and sustainably completing an update to the JCPRD strategic plan. Unfortunately, just at last night's board meeting, we received an update that the Rose Garden bids exceeded the design estimates due to the increased inflation and construction costs that we're all experiencing. The project will need to be scaled back or broken into phases in order to fulfill the initial vision. Our original legacy strategic plan is now 7 years old, and we continue to look to the community for feedback as we prioritize projects that we receive funding for. As you know, in 2016, we received a 0.75 mil increase to fund approximately half of the original legacy plan. Since that time, there's been a reduction to 0.726, and now a proposed reduction to 0.746. So the legacy plan is no longer funded at 50% of what was initially determined. Based on the 0.08 mil reduction, it will now be funded at 43%. So I would be remiss if I didn't mention that we are constantly being asked to do more with less. For now, our ability to provide services on par with what our patrons expect is not in jeopardy, but we will lose our ability to build out additional spaces and make significant improvements, particularly at the rate that has been communicated to us as a priority of this board. I am most proud of our Board of Park and Recreation Commissioners, our amazing staff, and the many volunteers that despite the concerns and ever-changing environment, we continue to provide outstanding parks and facilities and services that the JCPRD community has come to expect. There has likely never been a more important time for us to provide these essential services. In fact, as you know, Johnson County citizens have told us that of all of the services the county provides, JCPRD continues to rank among the top. Additionally, JCPRD Park and Recreation Services are now at the highest satisfaction level for Johnson County citizens. This level of satisfaction is exhibited in the over 10 million visitor participations welcomed to JCPRD parks, trails, and facilities during 2021. The JCPRD board has learned just this last evening that JCPRD ranks #1 in citizen satisfaction among all park and recreation agencies in the country, as surveyed by the ETC Institute. These resounding measurements indicate how important JCPRD services are to this community and that we want our efforts to continue. It was also noted in a survey that park and rec trails are reported to be the primary reason why residents move to Johnson County and stay in Johnson County. I often share my own personal story in regard to this. I moved to Johnson County in 1999 with my husband. Neither of us grew up here. We have no family within 2.5 hours of Johnson County. We'd both served in the Air Force and lived in many states and a couple of foreign countries. Since 2005, I have worked remotely, and my career as a solution engineer for the software industry has not required me to live in any specific location. I can choose to live anywhere in the country with access to a major airport, and I choose to live in Johnson County. With my youngest child graduating from high school just this week on Tuesday from Shawnee Mission East, I am once again at a crossroads in my life, but I love JCPRD. I also love the Johnson County libraries, particularly the Corinth branch. And so that's a key factor in my decision to stay here and retire. Excellence doesn't happen by accident. As you know, JCPRD is CAPRA accredited with 100% of the 151 standards on the CAPRA accreditation. We are also once again finalists for the National Gold Medal Award of Excellence, the first time we were eligible to win since we won in 2017. We are now a 7-time finalist and a 2-time winner in the Class 1 category. While we are extremely thankful for JCPRD's popularity, we recognize that there is still much more work to be done in our parks facilities and as they experience heavy use, and the Johnson County community continues to grow rapidly. As previously presented to this board, there are many unfunded needs that have been identified in the Legacy Plan and other comprehensive plans recently completed. We are committed to working with all of you, the JCPRD staff, and our community to continue our efforts to enhance JCPRD services as desired by our citizens. On behalf of the JCPRD Board of Park and Recreation Commissioners, please know that we greatly appreciate your continued support of our efforts, and at this time I will turn it over to Executive Director Stewart to go through the 2023 budget presentation.
Thank you.
Thank you, Commissioner. Again, good afternoon, Commissioners. We do have a lot going on at JCPRD and continue to be very appreciative of the citizens of our community, and certainly want to extend a sincere appreciation to all of you for providing the necessary resources and funding so that we can best serve all of our citizens as well as the visitors to our community. Our purpose is to enrich the Johnson County community through excellence in parks, recreation, culture, education, and public service. And I'm really pleased to share with you on the most recent community survey that 90% of our residents feel that we're successful in that mission. We're working on the rest of the 10% there as well. I'll go ahead and begin our budget presentation with an overview of JCPRD's 2023 budget request. You'll see that here on the slide. The proposed budget has been approved by the JCPRD Board of Park and Recreation Commissioners. The proposed budget does reflect a 0.08 rollback in the mill levy that is in alignment with the county manager's proposed budget. You will note on this chart how our funding breaks out among our general, employee benefits, and enterprise funds. Our total budget request is just over $83 million, as highlighted in the top gold box on the screen. And I would especially like to call your attention to the bottom gold box, where you'll see almost 48% of JCPRD's budget is funded through non-tax sources. And that's particularly interesting and of noteworthy because the average subsidy level is much different for park and recreation agencies throughout the country. That rate is nationally at about 26% on average. So
I hope that you and the public feel that this represents an excellent return on the investment in JCPRD services. Next slide, please. Some key points in the general fund are that it provides funding for the operations and maintenance for JCPRD's parks and trails, which host over 7.5 million visitors per year, and that's over our 10,000 plus acres that we now have in JCPRD's park system. Budgetary levels are comparable to 2022 with inflationary increases as that continues to shift, and includes the rollback of the mill rate of 0.08. It continues the implementation of our safety plan to include additional security cameras and other security equipment in our parks and facilities, and purchase of new and replacement of park police vehicles. Continues the implementation of the legacy plan as well as our capital outlay program. Presented here on the slide is JCPRD's 5-year CIP and CRP plan for 2023 through 2027. The plan reflects funding of projects through general operations and the legacy plan, JCPRD's strategic plan. Planned debt issuance include both project funded through general capital investment as well as the legacy plan investments. The key projects for 2023 through 2027 CIP are highlighted on the screen. Planned projects really touch or go throughout all of Johnson County and each division of JCPRD. From dredging the Heritage Park Lake, a project that isn't incredibly exciting, but is of top priority for our board as well as those throughout the community, to adding a park police substation or also replacing the irrigation system at the Tomahawk Hills Golf Course. And I was shared the other day by staff, it's the second oldest irrigation system, I guess, in the area. I don't know how they know that, but it is quite dated and needs to be replaced. It's important to note that the legacy plan is approximately 45 to 50% funded at this time. So we'll continue to prioritize and note that additional resources and future reprioritization of projects will need to occur as we can continue to fulfill the plan. Next slide, please. The proposed budget includes adding a natural resource technician within the Parks and Golf Courses Division. JCPRD's legacy plan called for this position, as well as the natural resource management plan. The position will provide natural resource management assistance to all of JCPRD parkland and trail systems, and again, that we have a little over 10,000 acres in total of JCPRD park property. Next slide, please. I'll now speak to our enterprise fund, showing a total budget of $30.82 million with no tax support. You will notice that the enterprise fund budget FTEs have been reduced to 359.88, and this is really due to some shifting of some positions and shifting the budgeted seasonal employee hours. Next slide. Some key points here for the enterprise fund. It does provide programs, classes, and special events for all ages, genders, and abilities. JCPRD offers over 4,000 programs and events on an annual basis. Programs and facilities host more than 2.5 million participations on an annual basis, and fees cover program expenses as well as the daily operation and maintenance of recreation facilities, which does include staff wages. Next slide. There is no request for additional resources at this time within the enterprise fund. And again, there's a slight reduction in the FTEs within the fund. We have revisited our objectives and strategic goals as well as our performance indicators, and we are certainly committed to providing excellent services to the community that are in alignment with citizen expectations. So we closely monitor the citizen satisfaction results as well as our many other important indicators, such as the visitation counts and number of park acres per capita as our community continues to grow. You'll note the yellow shade under operational effectiveness has improved over the last year and will continue to place importance in engaging citizens on making progress within our legacy plan and our ADA transition plan. We are also committed to organizational development as we support our gold medal team, and I'm pleased to share that we continue to score high here with 89% of staff indicating confidence and trust in leadership at JCPRD. Next slide. So I'll finish here where I started with the overview of the JCPRD 2023 budget request. I hope that you will strongly consider our request as you set the maximum expenditure for publication. And mostly, we want to thank you for your continued support. And so at this time, I'll pause for any questions that you may have.
Well, Jeff, let me make this comment. I really appreciate the work of the park staff as well as the Parks Board. You know, back in 2016, when we made the decision to increase the mill levy for capital improvements, we had, I don't know, 3 or 4 park areas which were in the district's inventory, perhaps even for as many as 15 or 20 years, and that parkland was not available for public use. And so thank you for keeping the commitment to why we had that mill levy increase. And Livingston Lake, Big Bull Creek, Cedar Niles, and then we had an opportunity at Meadowbrook. And we've got perhaps one left.
Camp Branch.
Camp Branch.
Camp Branch.
And so they have been opened, and some facilities have been provided for use of the public. So keep up the good work. I would include in that the Arts and Heritage Center and the management that your staff has given to the opportunities there. And so thank you very much to all of those who on the park board and the park staff for their good work in providing those services to our community.
Thank you, Mr. Chairman. I'll pass those words along.
Mr. Ashcraft?
Thank you, Mr. Chairman. Mr. Stewart, thank you for your presentation as always. Good job. Just a question I've asked others, and I just wanted to ask for you related to your performance measurement dashboard. Do you feel that these measurements are the measurements that matter in terms of representing the work that you're doing?
Yes, we do. A number of those measurements, you'll note, come from the citizen survey results, so we feel that it is necessary to include those as part of our outline there on performance indicators. A number of the others, too, we do closely monitor that and feel that we will continue to do so. With that being said, we are preparing to do an update to our strategic plan. We have accomplished much in the first 5, 6, even 7 years of that plan, but a lot has also changed. So we want to engage our community and kind of reevaluate, perhaps look at reprioritization. And so there could possibly be some changes in what we feel is necessary to measure pending results from that study.
Okay, very good. Just to clarify, though, one measure is citizen ranking of JCRP as most important service for Johnson County to provide as second. You feel that that's a critical measure?
Well, this is one of the measurements in the citizen survey. So I think the thought behind this is to make sure that we continue to rank among the top in this. Whether we need to put a specific number in there or not, I don't know is necessarily that important, but certainly wanting to recognize, and we do understand that the services that we are providing to our community are very high.
Okay. And we can discuss this next question offline. Visitation, and I know that's an important measurement for you, some 7 million plus. But I was looking at a report that said that the Flint Hills in Kansas was the most visited site in the state. And annually, they only have 250,000. So your measure is 28 times greater than Flint Hills. I'd be interested in kind of how you measure that versus how they're measuring it, because it just, conceptually, it didn't make sense. Not that I go to the Flint Hills that often, but it just trying to understand that difference there.
I'm wondering what the measurement is comparing to. Shawnee Mission Park, for example, my understanding is it is the most visited park in the state. It has over 2 million visitors on an annual.
No, I've heard that too, but
I'd have to look.
maybe we need to get credit for that is the observation. And the second thing, part of the presentation was that we're doing, or Parks and Rec are doing more with less. But I was looking at the Parks and Rec General Fund revenues, and between 22 and 23, it's almost a 38% or 36% increase. So can you elaborate in terms of the thinking of doing more with less, but yet having such a huge increase?
Well, I think with the strategic plan, on average, the forecasting is that we would see 5 or 6% growth in revenues in regards to valuation. So certainly we'll have ups and downs with that. We have experienced a very high spike in that with this year, and so that has triggered the rollback on that. So to say we're doing more with less, I think it could be twofold here. We provide more services than we ever have, and we really try to do that. I feel my chairperson is over my shoulder.
I made the
here.
comment, so I wondered if he wanted me to respond to it,
But
because
I
he's
think-
actually asking you about something I said.
Yeah, I do think that some of that too is we continue to add to the services that we provide to the community.
Yeah, to Chairman Islet's point, we've opened a lot more additional parkland in that time. And so obviously we're mowing more, we are patrolling more, we are providing safety plan and those types of things. At the time the legacy plan was created, the whole culture division within Parks and Rec didn't exist. So it's hard to do an apples to apples comparison.
Ms. O'Hara.
Thank you. So the increase was 38 million more? How much, what was the increase? I'm sorry, I lost track of it.
I think that was a number that Commissioner Ashcraft mentioned.
Okay.
38%.
36%. It's in the budget.
Okay, 36%. I'm not on that page. So 36%. So is a windfall from the increase in valuation that we're seeing?
That's all revenues.
All revenues.
Okay, all right.
Including enterprise, right?
Yes.
Thank you. Then I know that you're in conversations with the ownership of Deer Creek Golf Course. Where are those conversations?
I've had a conversation with ownership and in that, and we were approached that we haven't had additional conversations other than I had an understanding that they were looking into multiple options on what to do moving forward. But they have not come to JCPRD with any kind of proposal. It's not something that has been on our radar to this point, but certainly by invitation, I did sit down to visit with them. I did suggest that the City of Overland Park would likely be interested in visiting with them because their Parks and Recreation Department does have trails that actually cut through that property as well as on either side of it.
Okay, and then where are we on conversations with the Coleman plant? I believe that's 35 acres, and that building is torn down.
Yeah, my understanding that there's been great progress in removal of the structure. JCPRD has had some conversation with our partners in Overland Park who own the 35 acres that's just to the north of that. There seems to be an openness that if, in fact, that property is acquired by the county or there's interest in turning that over to JCPRD, that we could study that to see if there would be some improvements that could be made, such as trails that would benefit the community there. JCPRD's planning does show trails coming through that area, more on the southern point of it, but so that's something we'd be willing to have a conversation.
Okay, thank you.
You're welcome.
Let me just offer this observation about Deer Creek. I was there when the course was built, and the back nine has significant flooding issues, significant erosion issues, and one of the problems that they're facing, whoever owns that course, is literally millions of dollars of flood control and erosion control that must take place. So there are a lot of golf courses. I remember Meadowbrook, we were talking about acquisition there, and the membership said, no, it must be maintained as a golf course. And fortunately, we turned that down. And so I would be very, very skeptical about acquiring additional golf courses, especially Deer Creek. Mr. Myers?
Thank you, Mr. Chair. I lost a lot of golf balls on that golf course, and that's very unusual for me. As Mr. Stewart knows, I can hit a ball straight and long. But anyway, and Mr. Ashcraft, I just wanted to mention to you, the visitors to Flint Hill are K-State football fans driving to games, and you know you have to take pit stops before you can get all the way to the stadium. So that's why their visitation's so high. I can
That's a
assure you
beautiful
that.
place.
And
I don't know how to respond to that. Mr.
Yeah.
I should note that number does not include the cows. Ms. Allenbrand, it's getting late.
Chair. I want to thank you too, and also your commission in working with us on the budget. And it's kind of overwhelming because we're sitting here talking about how many visitors, but you look at that just in the last couple of years, you've got Bull Creek, Cedar Niles, and then you're talking about Sunflower coming up, and then we're talking about Kaufman project. And I think about what I do in 1 week that's with my grandchildren, how many different facilities I go to, parks I go to, and that makes my life better. So I understand the survey, not only what it does for my grandkids, and I'm sure my kids probably have dual comments or feelings because of all the running around they're doing. But I also, you know, you came before us at one point in time needing more park rangers. And one of them is sitting out here, and I was talking to him last night because my heart was broken over the shooting and what had happened in one of the city parks. And not that it couldn't happen in one of our parks, but one of the things he says, and I just want to compliment your rangers because they do close the parks down and they patrol those regularly. And not that it could have changed what had happened, but I think we also need to remember that our parks are patrolled. So I just want to make that comment.
All right. Any other questions or comments? Ms. Fast?
So in the legacy, I mean, you said you're going down to 40%. Because of the mill levy reduction, you're reducing the amount of funding to fund the legacy plan. Is that what you were saying?
What I said was we're approximately, the legacy plan would be about 45 to 50% funded. That's a moving target because things continue, the construction index continues to shift and so forth. We'll have some updated numbers as we go through and do an update to that strategic plan. So we'll have a better idea of where we stand.
So you're going to, like you said, have a new strategic planning or public input is that part of looking forward on is that, because the public interest in golfing has changed, now it's pickleball, you know what I mean? Some of those.
Yeah. Actually, golf is back.
Golf is back?
But yes, we actually, when we originally did the plan, we had 67 stakeholders and lots of citizen engagement. Our efforts with this update would be to engage stakeholders again, as well as the community. It's the community's plan, so we'll certainly have heavy participation from our citizens in that effort.
In the last 5 years, you did Lexington, Kill Creek, Cedar, Niles, We did Lexington Lake Park,
Big Bull Creek Park, Meadowbrook Park, and now Cedar Niles Park. And so the other large tract of land that we have yet to do first phase, which is scheduled for 2026, is Camp Branch Park.
And all of those, you had worked on some, or
Yes.
they weren't open at all?
They were not open.
Wow, and then you have where that horse ranch is, or you're going to, isn't that in the plan too, that you bought property? There's this beautiful house and,
The Stone Ridge property, it's
Yeah.
a 75 acres, which is in the middle of Cedar Niles Park. So we have master planned that property. It was a single family resident estate, essentially, and we were able to purchase the property for the value of the land itself.
so that your before and after school program, I have friends who they sit on their phone or computer, waiting to hit the button to get their child into your after school program because they love it so much. Where is that funded? Is that funded out of the enterprise or general fund? And I mean, to me, that's just a huge need, and you added on Olathe. So is that all fee funded, or how's that funded?
It is part of the enterprise fund solution, so it's not a tax-supported program. It's a very large program. As you noted, we added all of the schools within the Olathe School District a couple of years ago, which doubled the size of our program. We serve roughly, give or take, 3,500 children a day in that program.
Wow. Well, I just would like to say to my commissioners, Heather Rubish is my appointee, District 1, and at the library board, David Sims was my appointment. So both of my appointments are the chairs. So rock, District 1.
Well, I would like to comment, my appointment is here as well. So.
But he's not the chair.
Okay, thank you very much, Jeff.
Thank you all. Appreciate it.
And a reminder, revisit lists need to be completed, and
Yes, and
put your name on them.
yes, thank you very much, Chairman. And then the other.
Mr. Chairman, on the one list, I was waiting for a cost analysis before I was making a decision as to whether it should be on the revisit list, and that was the first category.
What item was that?
This has been a long day, Mr. Chairman.
Understand.
It was,
I think it was the one that Dr. Jacobson was talking about. Is it that one?
yes. And, yes, because it was a program that could reduce the cost of MedAct. So I was hoping that we could have I could have a cost analysis before I made a decision on that.
Well, that's fine. Go ahead and put it on your revisit list.
Yeah, then they can bring it
And when
down.
that information is available, why?
Work on that.
Yeah, no problem.
The other thing I wanted to point out is what's up next week, so you can focus your reading time on records and taxation. So that's the appraiser, elections, and TTV, and then support services, which includes BOCC and audit. And you can see the other departments on the slide. So that's what we'll be doing next week, and just wanted to get everybody focused on that. So you can quit thinking about this stuff and start thinking about that stuff, so.
And I believe those sections have been put into your books that were on your desks, or
Okay, all right. Thank you very much. That concludes our Committee of the Whole. We are adjourned.
Oh, it was in.
Okay.
How do you ever not?